Good morning, everyone. I will call this Board of Fire Commissioners meeting to order. It is May 6, 2025, and we'll start with a salute to the flag. If Chief Way could please lead us.
Of course. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much, Madam Clerk. If you'll help us call the roll.
Yes. Alexis Hill, Chair.
Here.
Jeannie Herman, Vice Chair. Michael Clark.
Present.
Mary Luz Garcia. Here. Clara Andriola.
Present.
Interim Fire Chief Dale Way.
Present.
Deputy District Attorney Michael Large.
Here.
And I'm Kathy Smith, Chief Deputy Clerk. You have a quorum.
Thank you very much. We'll now move into public comment. Chief Way.
Item number 3 is public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the Board of Fire Commissioners' agenda. The district will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments are to be made to the Board of Fire Commissioners as a whole.
Thank you very much. Madam Clerk, do we have any public comment?
We do. Brett Porter.
Good morning, all. Uncomfortable yet there, Davis? Good. My name is Brett Porter. I'm a fire captain at Truckee Meadows Fire and Rescue. I do not speak as a representative of my agency, but as the company officer in charge of the indomitable Pat Davis. I just want to preface, Davis has no idea I'm doing this, and I'm likely to get an earful afterwards. That just shows the pride and lack of ego he brings to the job. Firefighter Paramedic Davis is self-described as inappropriately optimistic. I had him as a rookie for a short period of time. We got run ragged over a shift. We checked in with him to see how he's doing. His response is, everything is a win. Several years later, his attitude hasn't changed. Davis's love for the job and desire to support those around him is nothing less than awesome. Not only that, but the contributions to the agency to increase efficiency in operations and streamline how we do business is nothing less than exemplary. Part of what makes these endeavors exemplary is because they are completely voluntary, and his no-quit mentality has helped him push through any constraints in his path. Davis is being honored with the Clinical Excellence Award and Life Saving Award. In the past year, he's also received an internal agency award called the Dalmatian Award twice, and is recently honored at a tips dinner for his service to the public. These honors are only a snapshot of the actions that Davis exhibits daily when he is on the job. I am honored to be Firefighter Paramedic Davis's captain, and I believe that Truckee Meadows Fire and Rescue as an agency and the communities in Washoe County are fortunate to have Firefighter Paramedic Pat Davis serving them. That's all. Thank you.
Thank you.
And no one else has signed in.
Okay, that was a great public comment. We'll now move into item 4. Chief Way.
Item number 4 is Commissioner and Fire Chief's announcements, requests for information, topics for future agendas, and statements relating to items not on the agenda. No discussion among commissioners will take place on this item.
Chief, do you have anything for us today?
We have a pretty long agenda, so I'm not going to add to it.
Okay. Vice Chair Herman.
The same.
Okay. Commissioner Garcia, Commissioner Andriola, Commissioner Clark.
I don't have no comment. Thank you.
Thank you. All right, we'll move into our consent items. Item number 5. Any commissioners have questions or comments? Commissioner Andriola.
Thank you, Madam Chair. I would like to go ahead and just pull for discussion item 5D from the agenda, please.
Thank you very much. Any other commissioners have questions or comments on that? I am looking
Madam Chair?
Yes.
If I could, real quick, just wanted to make acknowledgement of a couple of things on consent. Number 5B, want to just give thanks to the Nevada Peer Support Network in support of the Truckee Meadows Fire Protection District Health and Wellness Program. They are donating $1,144.95. And item number 5C is a recommendation to accept a donation of a lot of tools from one of our mechanics, Tom Gleason, who will be retiring, and that has a value of over $83,000. He's donating all of his tools to the district as he gets ready to retire.
Amazing. We have such a generous community, so thank you for pointing that out, Chief. Any public comment on those items, Madam Clerk?
There is none.
Okay, so Commissioner Andrilla, is that a motion minus your item that you're
Yes.
asking to pull? And may I have a second, please? Second. Thank you very much. Commissioner Garcia, any questions on that motion from the board? Seeing none, all those in favor, please say aye.
Aye.
Any opposed, please say nay. And that motion passes unanimously. All right, we will pull up item 5D. Chief.
Item 5D is a recommendation to accept and express thoughtful appreciation. Oh, I'm sorry, D. Sorry, hit B. Recommendation to approve a class specification and salary range as listed for a new executive office manager position and to unfreeze and reclassify the vacant position of executive assistant effective May 19, 2025 for possible action.
Thank you very much. Do you have some background for us on this, Chief?
Yes, a lot of background on this. As I've told even staff, we're welcoming our new employee, Sandy Francis, to the district after 13 years of being with the district because she is technically has been a Washoe County employee all this time, and the district has been paying her wages there. And as we did a study, a salary study, we found that she is somewhat underpaid for the duties she's doing from her position classification at the county that we've been utilizing all this time.
Right. And then for me, and then Commissioner Andrilla, of course, may have questions, the unfreeze and reclass the vacant position of executive assistant, what is that doing?
That is to keep that within the district as a position within the district in case, at some point, Ms. Francis will retire, and if we have to underfill it at a lower level.
Okay, but the board would be notified if a new position was?
Absolutely.
Okay, all right. Commissioner Andrilla.
Thank you. I just wanted to pull this item because it is, I feel really important to be transparent, and you always are, so I'm not suggesting or inferring that there isn't transparency, but just in giving clarification to the fact that the budget for FY26 certainly looks like there'll be some challenging times, and so knowing that one of the recommendations when it comes up for the review of the budget is to look at holding essentially vacant positions open just gave some question to understanding this particular situation. And then also, and I say this with all due respect, the fact that yesterday there was a new fire chief appointed and then giving that person the responsibility to which he will be tackling the budget and analysis of positions. So it was really coming from that place, Madam Chair, that I just thought it was important to share that information.
Yes, and I typically like reclassifications to come with the budget instead of separate from, but I'm hearing, there's Carla, I'm hearing that this has been in the works for many years, and Sandy has been underpaid, poor Sandy being pointed out during this meeting, but could you give us some clarifications?
So for the record, Carla Ribiaga, HR Manager for Truckee Meadows Fire. What we did is we reclassed the executive assistant to the executive office manager. So we actually got rid of that position and we're reclassing the same position. It's just a little higher salary. It's just one grade higher.
But we are also opening another position, essentially.
Right. It's a frozen position now. We're unfreezing it. Bringing Sandy over, we pay for her now through Washoe County. So we're going to bring her over. She'll be under our direct budget.
Okay.
And our systems.
Right. And it's a $13,000 hit to the budget annually?
I believe that's correct.
Okay. Looking to any other board comments or questions on this item? Are folks ready to, prepared to move forward and then discuss the budget? Commissioner Andriola.
This is a very difficult situation because I too think that it would be helpful to have it be a part of the budget. So, you know,
Do you want to table till we have the
I-
budget conversation and then
I
we
would
can discuss it
prefer,
then?
especially in terms of holding a position that's open and then just the balance of the vacancy. And I know it's been a long time and it's not against anyone and it's not to infer anything, but the dedication of everyone who works for TM. But I think giving full transparency to the entire process is conducive to include it in the budget.
Okay, so let's discuss it as part of item 14, way down later
Okay.
in the budget or in the agenda, and we can have it as a holistic discussion. Does that work?
Thank you.
Do I need a formal motion to table, DA Large?
You don't, we'll just table it until discussion of 14. We'll just have to do a separate vote.
Okay, thank you very much. Now we will move to item 6, and I look to the chief.
Item number 6 is a recommendation to approve a proclamation proclaiming the month of May 2025 as Nevada Wildfire Awareness Month for possible action.
Thank you very much. Who is going to do the proclamation?
Abby Pike with from Living with Fire.
Wonderful.
Are you here?
There she is.
All right.
And do you want a board member to read it, Chief?
I was going to give her the honor to read it
Okay,
if she'd
all right.
like.
Great.
Okay, I can read it. Do you have a copy of the
I do.
proclamation?
It's okay.
Good morning, Commissioners. Thank you for this opportunity. For the record, my name is Abby Pike. I'm the Washoe County Coordinator for the University of Nevada, Reno Extension. Here to read this proclamation today. Whereas wildfire significantly impacts Nevada's environmental, economic, and social well-being, and whereas proactive wildfire preparedness efforts save lives, property, and natural resources, and whereas preparing for wildfire includes managing vegetation, using fire-resistant building materials, and fostering community-wide collaboration to reduce risk, and whereas residents and stakeholders need to work together to prepare their homes and communities to survive wildfire and commit to being fire adapted. Now therefore, the Truckee Meadows Fire Protection District's Board of Fire Commissioners proclaim the month of May 2025 as Nevada Wildfire Awareness Month and encourage all residents to take action to become battle-born wildfire ready.
Wonderful. Yes, thank you. And Abby, do you have anything to say on behalf of Extension?
I just want to say we're so grateful for this proclamation, and we encourage all residents to go to livingwithfire.org for more information on how to prepare for wildfire.
Wonderful. Thank you for your work. All right, we'll now move into item 7. Chief. And
Actually,
wait, we have to make a motion on that. Madam Clerk, is there any public comment on that?
There is none.
Okay, I'm looking for a motion on the proclamation.
Move to approve.
Thank you, Commissioner Andriola. Looking for a second.
Second.
Thank you, Vice Chair Herman. All those in favor, please say aye. Aye. Any opposed, please say nay. And that motion passes unanimously. All right, now we'll move to item 7.
Okay. Madam Chair, I would ask for item 7 and 8, I'll just go down to the podium.
Wonderful.
We'll be busy for a minute.
Okay.
Could I get the Taylor family down here, please? The first part of item 7 is a probationary pinning of Mr. Brett Taylor. Again, August Eisenhagen for the record, Division Chief with Truckee Meadows. It is my pleasure to reintroduce Mr. Brett Taylor. He was briefly brought up when hired so that the commission and the public would have a face to the name. Brett was hired in early 2024 as TMFPD's new Wildland Urban Interface, or WUI, Community Coordinator. Mr. Taylor was born and raised in Bridgeport, California, before obtaining an associate's degree in fire science with TMCC and a Bachelor of Science degree in forest management and ecology from UNR. He currently lives in the district with his wife, Kim, and 2 sons. His fire career began with the Forest Service in 2008. He moved to the Nevada Division of Forestry Helicopter Attack Program in 2014 and promoted to the rank of Battalion Chief at HeliTAC in 2018. His skill sets are diverse, and he is involved in numerous aspects of fire and emergency response. In the year since his coming to the TMFPD family, Brett has, this is a long list, so bear with me. Brett has conducted dozens of community events, assisted with teaching forest management and defensible space with both UNR and Living with Fire, performed over 300 defensible space inspections for the public, assisted Washoe County Emergency Management with their revamp of the county hazard mitigation plan, and applied for over $10 million in grants, 1.5 of which has already been awarded and implementation is underway, providing defensible space establishment for the residents of East Washoe Valley, particularly the elderly and the disabled. This is one of our most popular programs that the division has taken on. Operationally, in the last year, Brett has spent 2 weeks in Utah as an Air Operations Branch Director on fires, a month in Idaho as an Air Operations Branch Director and Public Information Officer. Locally, he responded to both the Trail and Sullivan fires as middle management operational overhead. He filled the role of Air Operations Branch Director on our Gold Ranch fire and was the driving force and instrumental in coordinating evacuations on the Davis fire. If that isn't an impressive record for a first year, I don't know what is. I've personally worked with Brett for over a decade and couldn't be prouder to have him as part of the TM family. He has met his probation and then some. His wife, Kim, will be pinning him today.
Wow. Oh, congratulations. Thank you for your work. And what we'll do is do a big picture with all of us at the end. We'll do one, y'all should do one, but with the board at the end. I'm just letting y'all know.
All right, good morning, Commissioners. It's going to be tough to follow that up. For the record, Joe Shum, Division Chief Operations. If I could have Captain Meredith and family and Captain Ames and family to the front. Okay, good to see everybody this morning. So before the commission here, we have, I'll start first with Captain Meredith. Captain Brandon Meredith has been with the fire department since April of 2015. He served as a firefighter paramedic for a number of years before being promoted in late 2023 to the rank of captain. In order for him and Captain Ames to become captains for the fire department, not only did they have to serve their initial probation as firefighters, they had to go to engineer development school to learn all of the tricks and trades to be an engineer. They also had to go to Captain's Academy, which is another 80 hours of minimal training, followed by positional task books and so forth to get through their probationary year. So Captain Meredith has been with us since 2015. He's an integral part of our REMS team, our Rapid Extraction Module for wildfire support and rope rescue program. He's also integral in our telestaff and staffing software and programming, making sure we have the right people at the right time in the right places, and all of that integrates and informs payroll as well. Captain Ames has been with the department since 2016. Again, the same acumen needed in order to rise through the ranks. Captain Ames served as an engineer for a time before being promoted to captain. And again, he serves on the wet team for us, and he commands the engine out in in Hidden Valley right now. Here with them today is their families to pin them. If we would go ahead and pin the badge. Both of them have served for just over a year in the rank of captain and have successfully completed all expectations of their probation and then some.
Wonderful. Congratulations. Okay, for this portion, this brings us to a number of awards today. So quick rundown of how we're going to do this. We have over 50 awards that we're giving to employees both inside of our district and outside, including some citizens. So we're going to have them come down in groups to our right so that they're presented before you as they get their award from Chief Way and Chief Kettering. And then once that is done and a quick picture, they'll get a quick picture over here with additional chief officers in Class A's and some of our visitors. So we'll move through this in a successive pace. So one thing to note, even the best laid plans sometimes have hiccups. So as much as we tried to follow the lead time that our awards provider gives us and order these things in time, unfortunately, the physical medals did not ship. We've been notified that they'll be here next week. So Amazon is delayed. But nonetheless, we do have a certificate for each person. Wonderful. And a few of the medals that are here that we had on hand already, and we'll be giving those out today, followed by the physical medals when they get here to the individual employees at their station. So that is why we're doing it the way we are today. Great. Thank you.
If I could have group number 1, Captain Josh Cutts, Engineer Anthony Shiro, and Paramedic Greg Jameson make their way to the front. All right. I believe there are going to be some employees that weren't able to be here today. Sure. As much as we've filled the room with friends and family and supporters, not everybody could make it, so we'll be arranging other things for them. These folks are being awarded the Stork Pin. The Stork Pin is an award for an employee who was successful and a successive part of baby delivery in the field or in an ambulance while en route to the hospital. So these 3 personnel are recognized for their portion and contribution to delivering a baby on April 7th, 2024.
Oh, nice. Congratulations. Thank you. Great work.
Good, thanks.
Okay, as they make their way over here to have some pictures with other chief officers, we'll call Group 2 to the podium. Captain Noe Henry, Engineer Shad Vetrock, Firefighter Paramedic Bo Retzer, Firefighter Paramedic Patrick Davis, Firefighter EMT Joseph Iguin, Captain Mike Kristoff, again Engineer Anthony Shiro, Firefighter Paramedic Matthew Newthall, Firefighter Paramedic Ryan Arnaud, and Firefighter Paramedic Jaden Protain. This is a new award for the district. These individuals have been selected to receive the Clinical Excellence Award. This is an award for an employee of the district who, while on duty, was principally involved in exceptional clinical medicine, preventing a patient from succumbing to critical life threat during fire department patient care. Oftentimes, this is a return of spontaneous circulation, which is restoration of a heartbeat, where the patient survived cardiac arrest to receive care in the hospital. But unfortunately, sometimes they succumb to their condition or other interventions, or this award can be for other interventions of exceptional levels related to medical conditions or traumatic injuries. So incident 1 was Captain Henry, Engineer Vetrock, firefighters Retzer, Davis, and Aguin. They performed with professionalism and composure to deliver a patient to the ER with circulation on January 1st, 2025. Captain Christoph and Engineer Shiro, firefighters Newthal, Arnaud, and Protein did the same, did similar. They performed with professionalism and composure to diagnose, treat, and deliver a pediatric choking patient to the ER, where a popcorn kernel was found in the lower airway. That happened on December 3rd, 2024.
Wow. Great work. Life-saving.
Okay, group 3. Can I have Captain Hirsch, Engineer Shad Vetrock again, firefighters Watson, Clary, and Sawyers. And if I could also have our citizens, Bernardo Noriega and Bernie Hauskamp, come to the front. Okay. Lots of folks were involved in this one, so bear with me here. So first off, we have Captain Derek Hirsch, Engineer Shad Vetrock, and firefighter paramedic David Watson, firefighter paramedic Kason Clary, and firefighter EMT Dylan Sawyers. They worked together with our citizens who are going to be recognized with professionalism, composure to deliver a patient to the ER with return of spontaneous circulation. They are receiving the Clinical Excellence Award today. Prior to the arrival of Captain Hirsch's crew, the 2 civilians were providing aid to the patient. So today we are honoring Bernardo Noriega and Bernie Hauskamp with the Chief's Medal of Commendation. This medal is awarded to those who render initial, spontaneous, and valuable aid or assistance at an incident to which the fire district is responding, and the aid resulted in reduced loss or injury to the victim. On January 2nd, 2025, these 2 gentlemen observed a vehicle in a parking lot with the accelerator pinned to the floor. The engine was revving highly. Inside the vehicle was a pulseless person. They activated 911, and prior to Engine 46's arrival, they removed the patient to begin bystander CPR. The patient was then transported to the hospital with return of spontaneous circulation. So for their actions today, we are thankful for Bernardo Noriega and Bernie Hauskamp receiving the Chief's Medal of Commendation.
Oh my gosh, wow.
Okay, group 4, can I have Captain Noe Henry, Engineer Nicholas Raw, firefighter paramedic Patrick Davis, firefighter paramedic Greg Jameson, firefighter EMT Dylan Sawyers, Captain David Kearns, Engineer Vincent Mergolo, firefighter paramedic John Williams, and firefighter paramedic Jeff Bodie to the front. This presentation is for the life-saving commendation. This is the 3rd highest recognition for an employee or an employee of another public safety agency To receive the life-saving commendation, the recipient must be a member of public safety who is principally involved in saving the life of another person and whose personal actions are directly responsible for the life-saving act, to include cardiac arrest, respiratory arrest, return of spontaneous circulation that has been confirmed and the patient was discharged from the hospital. Truly remarkable.
Right. Amazing.
Most often, this is with minimal or no deficits, meaning they lead happy, healthy lives after. So there's 4 total incidents. This is just 2 of them. Captain Henry, Engineer Raw, Firefighter Davis, Jameson, and Sawyers. We received notice from a Northern Nevada Medical Center physician who said the crew was on point and delivered the patient to the ER with a return of circulation. Everything was done according to protocol and of the highest standard. Ultimately, the patient was discharged with full health and good spirits and made a full neurological recovery. Their transport was on August 22nd, 2024. On incident number 2, Engine 33 arrived on September 17th, 2024, finding a man down in his kitchen, not breathing and pulseless. With composure and professionalism, the crew provided life-saving measures, obtained spontaneous circulation, and the patient was transported to the hospital. They were subsequently discharged home in the ensuing weeks. For that, we give these gentlemen the life-saving commendation.
Great work.
I appreciate you, Chief. Thank you. Good job.
Okay, continuing a life-saving trend, this is another large group. We have Captain Miguel Orduña, Engineer Anthony Shiro, Firefighter Paramedic Cameron Chappelle. Also with us today is Dispatcher Alicia Saunders, Paramedic Clifton Arnold, and Paramedic Raymond Justice. We have Washoe County Deputy Sheriff Aubrey Hayes, Reno Fire Department Captain Jason Leggett, Operator Sean Price, Firefighter Manny Fuentes, and Firefighter Blake Harper. Also today with us, I'd like to recognize that we have Communications Director Shannon Popovich, Sheriff Balaam is in the house, Under Sheriff Phil Jones is with him, and then Fire Chief Dave Cochran and Operations Chief John Mandel. If you folks want to come to the front left, we can have you have a picture with your folks after the presentation here. This is truly one of those events and incidents that is remarkable across our valley. You have heard about this incident. Chief Moore spoke of it as it happened. But we're here today to award these fine individuals the life-saving commendation for their efforts. On November 22nd, 2024, a 19-month-old child was unresponsive in a hot tub. Thanks to the parents, quick CPR, and the rapid coordinated efforts of Engine 44, Reno Engine 10, REMSA, Deputy Hayes, and our dispatchers, the child was resuscitated and made a full neurologic recovery. The responders' professionalism, teamwork, and composure under pressure were crucial to the positive outcome. We want to acknowledge all of those who played a role in the incident and make sure they deserve the recognition, they get the recognition that they deserve for being partners in the community and providing outstanding service.
Oh, this is a region-wide effort. Congratulations. Thank you so much.
So these are some of the medals that we did have in stock, if you will. So we're able to give our partners at the Reno Fire Department their physical medals. A description of the medals is a ribbon that can be pinned, as you see some of our folks, as pinned to their Class A's. And then there's a commendation bar that can be worn on the daily uniform above the name badge. so that these folks can have that recognition anytime they're dressed up, and folks can see the efforts that they put forth. Thank you. Thanks, Jen. Good work. Thanks, sir. You bet. Thanks, sir. You bet. All right. You bet. Yeah. Okay, we're going to have a small transition here. For Group 6, I'll call the names forward, but Wildland Division Chief Eisenhagen is going to present those awards. So could I have Wildland Battalion Chief Adam Crichton, Fire Captain Patrick Hughes, Wildland Captain Colton Hughes, Wildland Captain Logan Nordyke, Wildland Captain Colin Thompson, Wildland Engine Operator Tobin Schultz, Heavy Equipment Operator Justin Hansen, Firefighter EMT Thomas Witzman, Wildland Firefighter Tabor Kolmos, Wildland Firefighter Andrew Schmid, and Captain Ian Satterfield to the front.
Good morning again. For the record, August Eisenhagen, Division Chief with Truckee Meadows Fire. I specifically asked to present these awards for several reasons, not only as the division chief that oversees wildland operations within the county, or as the incident commander during the first several days of the Davis fire, but even more so as a citizen. If I could change into civilian clothes to give these awards, I would gladly do it. Even more so as a citizen whose family and friends were directly affected by the incident. So, not in uniform right now. This comes from the community. My family lives 3 doors down from where the burn perimeter is. My children learned to fish at Davis Creek Pond and the threatened Maryland Pond at Galena Creek Park. My family's extensively involved in scouting of America and has countless memories in the Davis Creek area, and my entire childhood was spent growing up next to the park. My thanks in these awards carry substantially more weight as a man whose entire boyhood memories revolve around the area, and as a dad and husband whose children and wife have so many special memories in the area saved by everybody that responded. I might get a little mushy, I apologize. As the incident commander of the fire, I can't overstate the heroic effort of all involved. The fact that we weren't recovering bodies in the aftermath still surprises me. While I mourn for those that lost everything, the actions of thousands of responders and citizens prevented that mourning from being exponentially larger related to the destruction that should have occurred. While I could never capture each scenario of selflessness or heroism, there were 3 pivotal actions that resulted, from my perspective, there were 3 pivotal actions that resulted in the protection of life and the mass protection of countless homes and property. These 3 instances are what I want to honor today with this group. So we have it broken into 3 different scenarios, again, all centered around the Davis fire. First up, we have Wildland Battalion Chief Adam Crichton. The scenario for him at approximately 2 in the morning on the second morning of the Davis fire. Mind you, nobody slept at this point. Battalion Chief Crichton was reconning for potential control line locations by himself south of Mount Rose Highway at the foot of Slide Mountain. Completely alone, middle of the dark, 1,000 yards from the road. And working with the night flying helicopter. While he was doing that, he discovered a lost, disoriented, and barely clothed civilian above the fire. The individual was covered in retardant, had numerous superficial wounds, and was too weak to walk under his own power. Chief Crichton performed the needed steps to physically move the individual to a safe location and the closest access point for road pickup, and to get assistance en route, and he did all of this flawlessly. Adam's presence in the area while going above and beyond normal operations under his own initiative saved this civilian's life. There's little doubt in my mind this citizen would have perished, if not from the fire, then from exposure, dehydration, and malnourishment. Due to Chief Creighton's initiative, composure, and the ultimate outcome of this scenario, he is being awarded the life-saving commendation. Next up, we have a large group that are receiving the Medal of Bravery. The Medal of Bravery is the second highest recognition for an employee or an employee of another public safety agency. To receive the Medal of Bravery, the recipient must be a member of public safety who performs an act or acts of distinguished bravery and stamina in adverse conditions of fire, environment, weather, or other hazardous scenes. So we have two scenarios receiving this medal. First up, let's see, we have Captain Patrick Hughes, Wildland Captain Colton Hughes, Wildland Captain Logan Nordyke, Wildland Captain Colin Thompson, Wildland Engine Operator Tobin Schultz, Heavy Equipment Operator Justin Hansen, Firefighter EMT Thomas Witzman, Wildland Firefighter Tabor Colmoose, and Wildland Firefighter Andrew Schmid. But prior to speaking to these individuals, I also want to acknowledge two external crews, Silver State Hotshots out of Carson City and Slide Mountain Hand Crew out of Incline Village. While not Truckee Meadows employees and not receiving formal recognition today, they were pivotal in the operation that I'm about to outline below. So TM and its citizens, they are deserving of gratitude from TM and its citizens. So this scenario, several days into the Davis fire, we're on day 5 or 6 at this point, a large wind event occurred. The southern flank, if everybody remembers correctly, this is the day we were worried about it making a 7-mile run to the north and taking out, I believe there were about 800 homes in that area. That was the focal point, but the southern flank down on the front of Slide Mountain continued to move south against the wind. While that was occurring, it was being pushed back into the already burnt area, but continued to spread south. Had that continued to move south and come in alignment with the wind, it would have pushed back down into Washoe Valley into new homes, and the models had it potentially spotting across Washoe Lake and taking out portions of the East Lake community as well. The terrain, well, to paint a picture, so this is the face of Slide Mountain. If you're in Washoe Valley looking up, this is the face of Slide Mountain below the access road to the East Mount Rose parking lot, if everybody can envision that. Fire's moving across that below the road. This group decided that the risk was worth the reward and decided to engage there, which we would never normally do in wildland fire, given the risk to responders. The terrain was so steep that ropes had to be used to secure their balance and footing as they descended to do their work. They were fighting fire downhill, which is one of our main watch-out situations. The slope below the road is nearly vertical, and engagement there would, as I said, would never have been entertained in a normal wildland fire scenario. Let's see. Extreme winds and hazardous conditions made this operation extremely challenging. Numerous beehives were encountered. One of them was stung, I think, 8 or 9 times during this hose lay operation. Yet they all continued to push through, securing that southern edge and protecting countless homes in West and East Washoe Valley through their actions. Because of that, this group is receiving a Medal of Bravery.
Wow, great work.
All right, and then lastly, but definitely not least, Captain Ian Satterfield. So on the same day, well, the night before the same wind event, when we're expecting the Davis fire to run north 7 miles through 800 homes, Captain Satterfield was in charge of the branch that encompassed the Galena Creek Park and the area of the fire in between there and Reindeer Lodge. Large swaths of uncontrolled fire line remained between the edge of the fire and the next potential control barrier to make a stand. Captain Satterfield devised and oversaw the implementation of a risky, large-scale, complex nighttime burn operation to secure the flank. This operation, while not desirable, was the lesser of two evils. Do it and try, or wait and watch. Both were likely to result in our 7-mile run. As an incident commander on an incident management team, I cringe at the thought of having to make that choice. When large-scale teams move in to help on incidents, it is easier to make decisions based on likelihood of success. Part of that is a separation or insulation from the community. You're typically not making those decisions on fires in your own jurisdiction. With being a TMFPD employee embedded with the Southwest management team on scene, Captain Satterfield picked the proactive choice, knowing that both scenarios were likely to fail. If failure had occurred, the infamous 7-mile run was likely, and Ian's emotions and reputations would forever carry that weight. The burn worked and held on through the following day despite the odds. This decisive and courageous choice probably saved countless homes in the communities to the north of the fire and resulted in the 7-mile run never occurring. Captain Satterfield's composure, decisiveness, skill, and courage directly deserve credit for that not happening. Due to these attributes and the associated outcome of his actions, Captain Satterfield is being awarded a Medal of Bravery.
Impressive group. You saved our community. Thank you so much.
So with that, that concludes our awards portion.
Okay.
So it goes without saying, but these are just some of the many examples. Oftentimes we don't hear about a lot of the good work that our folks do out there in the field. Humility and being humble is one of the traits and characteristics of a firefighter. So a lot of times we don't hear about them. But these are the ones that we know and we want to draw recognition to. And we're always thankful for the work that everyone puts in every day, whether they get recognition or not. And that's what makes Truckee Meadows Fire, Truckee Meadows Fire. So at this time, I'd like to ask for all of the award recipients to make their way to the bullpen to get a picture with the commissioners.
Yeah. I forgot about
For the audience members, at the conclusion of this, I know there's a lot of eager family members that would also like pictures with your loved ones, other crew members. We have time and space available in the foyer after this portion. So thank you.
Yeah.
Okay. We are now on to item 9. Chief.
Item 9 is the International Association of Firefighters Local 2487 report for discussion only.
Okay. He's coming.
Yeah, mass exodus.
A little crowded in the aisle there. All right, for the record, Jim Clauser, President, Local 2487. Let me start by saying thank you directly to the commission for your work in helping us get a new chief. I know it was a tremendous amount of effort and thought put together to really do the entire thing start to finish, from hiring the best recruiter possible to your participation in the interviews and everything else. The meet and greet event was phenomenal and somewhat groundbreaking. I don't think we talked to anyone who had been to something like that before, so thank you for pioneering that. I'd like to personally, and on behalf of our body, thank Chief Way for participating in this and for stepping up to be our interim chief. Your work and effort has not gone unnoticed, and we appreciate the courage that it takes to step up into that role and into the process that we saw yesterday. So thank you. Last but not least, our Guns and Hoses tournament was a couple weeks ago. Tremendously successful once again, raised over $39,000. So thank you to everyone who participated in that. Washoe County Sheriff's deputies, everybody else that was a part of that event was amazing. Since its inception in 2013, we've raised over $300,000 for Northern Nevada Children's Cancer Foundation. So that was a tremendous success. So again, thank you all. We appreciate it.
Thank you. We appreciate the update. And now, yes, on Guns and Hoses. Yes, the fundraising effort, absolutely. We'll now move into item 10. Chief.
Item number 10 is a presentation on dispatch to include the history, service delivery, and collaborative efforts between Truckee Meadows Fire Protection District and REMSA for discussion only. Chief Kettering and Shannon Popovich from REMSA will be presenting.
Thank you. I asked for this presentation because the board has not received an update on our contract with REMSA, and there's a lot of discussions about regional dispatch and what that looks like, and I thought we should just ground ourselves on what we're operating with today and have a discussion from there. So thank you so much.
Good morning. For the record, Chris Kettering, Deputy Chief, Truckee Meadows Fire. I'm joined today by Shannon Popovich, the Center Director for REMSA. I just want to say, when I was asked to put this, we were asked to put this presentation together, there's a lot of information here, and this presentation is going to be quite lengthy with the information. So I will try to hit some of the cliff notes to get through it. But before I start, I want to thank and take a moment and thank all the dispatchers from all the different agencies, REMSA, City of Reno, City of Sparks, and Washoe. They are truly our first line in emergency response, and we fail to thank them enough. And so, and as we move into this presentation, we're going to talk a little bit about processes and programs and technology. And I don't want any of the dispatchers to think that we're taking anything away from what they do. This is not about those men and women who do the job every day. We're more focused on some of the processes and technology. So with that, we'll get started. If I could find my clicker. To do this, we thought we probably should start with a little bit of a review of terminology. We use all kinds of acronyms, so we thought we would go ahead and start there. We'll do a little explanation of the radio systems, because I think there's some confusion on which radio system Truckee Meadows is on. And then the historical background. Some of the commissioners were not on the board when we did this transition, so we thought we would go back in time and kind of go over those staff reports, go over the term of our agreement, what our infrastructure costs were, some of the lessons we've learned along the way, some of our growth and development that we've done, a little bit about call processing and complexities that we have with dispatching for Truckee Meadows Fire. And I will turn it over to Shannon, and she's going to lead us off.
Hello, Shannon Popovich, Director of Regional Communication for REMSA, for the record. So we wanted to start off with some terminology because that's going to be useful as we go through this. Some of you may not know it, but we just wanted to ensure you are prepared as best you could. And if you have any questions, please ask. So a PSAP is a public safety answering point. When you dial 911, your call goes to a PSAP. And all PSAPs are registered with the FCC. We're given a number. There's certain things that we have to have and establish to be a PSAP. CAD is the computer-aided dispatch equipment. It's the software platform that when somebody calls, we ask questions, we enter it into the computer, and the CAD does so many more things than just receiving that information. The notes of the call transmit to the MDT, which is a computer inside of the fire engines and the ambulances. It tells us who's the closest unit, what kind of equipment they have. So the CAD is like the dispatcher's main piece of equipment. Currently, Reno, Sparks, and Washoe County are on a CAD system named Tiburon, and REMSA is on one that is called TriTech or Central Square. So we're on two different operating systems, but within that, we're going to talk about how we work together. And currently, we are working on a project to put all agencies, all PSAPs on one CAD system, and the name of that platform is Hexagon. We are looking to be moving to that as a region in October of this year. EMD means Emergency Medical Dispatch. It is a certification and a tool that we use while we're taking medical calls, while dispatchers are taking medical calls, and it runs you through specific questions to get specific answers, and then using that, we're able to give pre-arrival instructions like CPR, childbirth, how to relieve somebody that's choking, lots of things to start the care of the patient before the responders arrive. EFD, very similar. Emergency Fire Dispatch, it's also a system, a certification that tells us to ask specific questions for specific types of fire responses for car accidents, burning buildings, alarms, floods, all of those types of things. We are able to determine what types of resources need to go after asking the questions, and then again, give pre-arrival instructions. Get out of the house, get out of traffic. It even tells us how to help somebody who is stuck in a room in a burning building, how to safely get out. So there's again, to start the care, to start the safety before responders arrive. Did you want to speak on this one?
Sure. Caught up here. AVL, I'm sure you've heard it a lot. Basically, the easiest way to explain it is a GPS on the apparatus and the units that we have. So it allows us to determine where we are geographically. The differences are as a static response pattern and a dynamic response pattern. So with a static response pattern, yes, everybody can see on a map where our engines are, but they're not being dispatched from where the incident is, determining where the apparatus is. So what you do is you create a fire response district, and they take the area from the closest from the fire station. And the GIS individuals, they will create from this fire station to this location is this amount of time. And so as you move stations around and build new stations, you have these fire response districts, and so you'll basically dispatch on a run card. So for example, like in District 33, if it was still a static response model, that GIS data would be from the fire station, not where the apparatus location is, and it would dispatch that engine based on that. A dynamic response pattern is actually using AVL and what it was intended to do. If you have an incident, it will ping those apparatus to see which is the closest and most appropriate to that incident, and it will dispatch them. And that is the service that we have with REMSA. We use that dynamic response model. The Tiburon model will still show you AVL and it'll show you the apparatus, but that function is not being utilized.
And I have a question on that, just real quick. I've seen that we have, our first responders have an app where they can also see. But that's on their personal phones, so, right? It's not on their work phones?
Well, currently, we do have cell phones in all the apparatus, but they also have them on their personal phones as well.
Okay,
So
we do.
Yeah, I have it on my work phone as well.
And it's part of that, is part of the process, that app?
What that app does is when they create the call and send it, it comes up on their phone with all the information on it. It's basically kind of like their MDT and their apparatus, but it's on their phone.
Okay.
And you can use it to route yourself to the calls. We use it in conjunction with automatic aid, with Reno and Sparks. They can kind of see where the units are, and it kind of helps them determine who's closest.
Okay. Okay. Thank you.
Automatic aid, it's a prearranged agreement between fire agencies to respond automatically when requested. We have a cooperative agreement. It contains a lot of the information and details, and mutual aid and automatic aid are included in that, and that's broken down into what we call an annual operating plan that has a little bit of details on recovery rates and reimbursement rates for that. Enhanced automatic aid is technically not an official term. I believe it was created when Truckee Meadows and Sparks agreed to this process, and that's the name that they used. I cannot find it in any of the documentation. So the difference between automatic aid and enhanced aid is the philosophy behind it was we wanted to send the single closest unit to the most common call types, and those are usually medical emergencies, car accidents, alarm activations. And so that's the process we've been using with Sparks for 7 years now. And the way that it works is our station could be close to a call that's in the actual city of Sparks. Their station is farther away. That 911 call would come into the Sparks Peace app. They would enter in with the addresses. It would pop up and it would say enhanced aid to Truckee Meadows Fire. They transfer the call over to REMSA. We dispatch and then we send the unit. And that's kind of how the system works. Did I nail that one?
Yeah, we'll elaborate with photos.
Yeah. So now I'm kind of, do you have any questions on that before I move on?
Looks like we're good.
Okay. The radio system. I've heard that Truckee Meadows isn't on the same radio system, and I just want to be perfectly clear. Truckee Meadows is on the Washoe County Regional Communications System. It is a 800 megahertz system. It is a statewide system. We are on that system. So is the city of Sparks, so is the city of Reno, RPD, the Washoe County Sheriff's Office. We are all on the same system. The difference is that we all have our own talk groups. It's basically a channel that's designated for your agency, and it has our dispatch channels, command channels, tactical channels. When we respond into each other's jurisdictions, we will switch over to those. Our apparatus on the mobile radios, they have a little cheat sheet on there. They can hit a button, it'll take you directly to Reno or Sparks. The difference is that REMSA dispatches on a UHF channel, which is different from 800 megahertz. Most of the agencies program their channels into the radios. We have what they call a tri-band radio. You can have 800 megahertz, VHF, and UHF all in that radio, so you can switch over and talk to individuals. We also have the ability to cross-patch those channels. So at the dispatcher console, they can push a button, and if we needed to cross-patch a channel with REMSA and us, we could do it almost instantaneously. So that creates that interoperability that you hear all the time. Now, moving forward in REMSA's franchise agreement, you've probably heard wearing the other hat as a county commissioner, P25. And that update, when we go to P25, it'll allow more licenses, and they'll be switching over to that system.
And go ahead, yes, Commissioner Andrioli.
I didn't want to interrupt you.
Yeah, go ahead.
I just wondered on the time frame for the P25, what that looks like.
It keeps getting pushed back, so I am hearing 27 now.
2027?
Mm-hmm.
And
So.
is there equipment delay or?
It'd be better if I brought that information maybe back to
Okay,
you. As I have
thank
some
you
more
so
details
much.
on it.
Thank you.
And when the call is made, and this may not have to do with this part of the system, so you'll have to help me, but when the call is made and it's automatic aid, and we're called to a Reno call, and then we know we're going to get there sooner, we have to call Reno dispatch and say, don't have them come? And is that on the radio?
Yeah, the thought process there is to send both units at the same time, and then have the engine captains. They know those areas better
Right.
than we do, and they will work it out between themselves on who's actually closer and who's not, and then they'll cancel each other.
On the radio,
Mhm,
right?
usually the
Okay.
radio, yep.
Thank you.
All right. So a little bit about the historical background from when we transitioned back in April of 2021. The Board of Fire Commissioners directed us to find some alternatives and some solutions to the dispatch services. These were the 5 recommendations that were presented to the board. The first one was maintain status quo services with Washoe County Sheriff's Office at a cost of about $1.3 million. We also evaluated a contract for services with the City of Reno for approximately $118,000. We looked at contract for dispatch services with the city of Sparks, but that just wasn't recommended at the time. Contractor services with REMSA, the original cost projection was $690,000, and it actually came out to about $607,000 when it was all said and done. And then we also looked at establishing our own independent dispatch center. And then on July of 2021, the board did approve our recommendation which was recommendation number 4, to transition over to REMSA Dispatch to provide those services for Truckee Meadows Fire. I'll kind of go over some of the areas that we looked at, and that was presented to the board on why REMSA was the selection. It was maintaining our current cost and long-term cost savings for services. TM co-responds about 85% of the time with REMSA. Most of our incidents are medicals. That was at that time. It's probably a little lower now because we've increased our ambulance in our limited response zones, so that co-response is probably down a little bit. It increased information sharing because of those medical incidents, because of the EMD processing that REMSA does. Dynamic response patterns that I talked about with the ABL, that was very, very important to us. Improved utilization of our ambulance responses, both between TM and REMSA. We were both responding ambulances. It lowered our annual increases of approximately 2% per year. We were able to actually integrate our CAD data straight into our EMS billing software. That couldn't be done on the Tiburon side. And then we had a little bit more control of our fire-related dispatch policies. Those were the items that were presented to the board back in 2021. Did you want me to review any of the other ones, or no?
Does the board want more info? Not looking like it.
The other question we were asked was, what's the term of the agreement and what were our infrastructure costs when we did stand up? The original agreement was for 3 years, and we have an automatic 12-month extension if neither party request changes. Currently, we're in that 12-month extension period, and we are working with REMSA on an agreement to maybe bring back to the board. So our startup costs were approximately $705,000. We were able to get about $394,000 of that reimbursed through E911. Those were mainly for the consoles and the licensings. REMSA waived $100,000 in fees. Waiving those fees was for a lot of the administrative costs and also the redesign and reconstruction of their facility to house our consoles in the dispatch center. That was probably the biggest portion of that $100,000. So total out-of-pocket expenses when it was all said and done was about $211,000 for us to transition. Last year we did do some infrastructure upgrades. We ordered 2 base stations and antennas for those, and really what we wanted was those antennas to be able to reach our apparatus out in the field for our VHF radios and also for our 800 radios if the dispatch consoles did go down. It's basically a backup to ensure that we had communications with our staff. So down below, I know it's a lot of numbers, but it just kind of breaks down what the costs are for the dispatch center through the years. The one that I'll kind of key on is what was projected in 2025, that's this year. It looks like we're going to hit that mark of $642,000. What I want to talk about there is in 2025, we're going to spend $642,000 for dispatch services. In fiscal year 2021, our costs were $875,000. So we're still below that, and it's really hard to calculate out what our increases would have been if we would have stayed with a different dispatch center because we don't know what those costs are. So what I did was I just left those flat. And if we did a comparison of it stayed at $875,000 and didn't increase, and I calculated in what those increases were for us, it's about $800,000 that we've saved in costs for being with REMSA Dispatch. So kind of our lessons learned through this transition. It wasn't as smooth as we would have liked. We had to learn some stuff the hard way. There was definitely some frustrations from our staff and from the field and from dispatch and the dispatchers. But one of the things that we recognized was the transition time was way too quick. We thought we were ready and we weren't. So we required a lot of transfers of our programs, like we talked about First Due, our reporting systems, our EPCR for medicals. Reporting, we flipped all those on at the same time. And when we were in the training phases, everything seemed to work. But when we went live, it did not. There was a lot of communication errors, and so we had all these systems go down, And the good part was the calls were coming in, we were dispatching the calls, but all the ancillary stuff that is there to support it, we had to prioritize and get those all back online, which created a lot of frustration. And so we, incrementally, step by step, working with the companies, we were able to get them back online. Also, the timeline was, there was a shortage of sufficiently trained EFD personnel to bridge the turnover gaps that we had at the time with dispatch. And so that created some problems, making sure that we had the EFD personnel on the consoles.
What is EFD again? Sorry.
Emergency fire dispatch.
Okay, from REMSA.
Yes.
Okay.
It's part of the, do you want to? I'll turn it over.
It's the certification and call-taking process for fire-related calls as opposed to how we do it with medical, but that's the fire process for it. And what he's getting at here is the timeline to have sufficiently trained fire dispatchers. They didn't give that enough time during then because you have career medical dispatchers who have very little insight on what fire protocols and procedures and things that the fire department does. So because they didn't understand that, it was difficult for them to support the firefighters' needs at that time.
Yeah, what we should have done is taken more time to run a lot more scenarios on the type of calls that we have, structure fires, extrication accidents. So those are that was the lesson that we learned. The other issue is multiple EFD changes. So EFD was new to us, and we were trying to match what the city of Reno was doing and the city of Sparks was doing. And it was kind of like a cafeteria plan of selecting what you wanted. And of course, we wanted the Cadillac. And so we made all these EFD changes and all these different response models for our apparatus, which was different for our crews, different what we were used to, and it was too much. And that created some confusion and complications. And then we had some lack of communication regarding our enhanced auto aid processes with other agencies, and that dealt with the mapping. And what had happened is that the calls were still coming into Washoe Dispatch from Sparks in our enhanced aid areas. And to stop that, there had to be some changes in the mapping, and the maps got flipped. And so what Sparks was seeing was an enhanced aid to us. On our side, we were seeing it as an enhanced aid to them. And it created a lot of confusion with the dispatchers saying, this is your call, this is our call. And I do want to acknowledge Jen Felter from Washoe County Dispatch. When we recognized what the problem was, we reached out to her, even though we had just transitioned away from that center, and she jumped right in, and she was able to pinpoint it and help us walk through what the GIS people needed to do to fix it. So I just wanted to make sure she was acknowledged for that, because it was great for her to do that for us. Some of our growth and development that we did, we assigned a battalion chief as our liaison for dispatch to work through all the issues that we were having with the field and with the dispatch center and to help build the program. And so we were able to improve some of our procedures, addressing concerns from the field and also from the center. We scheduled bi-weekly meetings with REMSA, and that was what created that open dialogue back and forth, and so we could get updates on where we were at with things. That process even progressed even more. We invited our union leadership to those meetings as well, so they could see firsthand what we were trying to fix, because there was some frustration in the field. We also brought in Shannon to do an all-staff meeting to hear directly from our staff what some of their concerns are, and I think we're probably due for another one here pretty soon to help try to alleviate some of these issues. And then we actually utilized our staff feedback to fix the EFD process, and we listened to this is how it needs to be, and we took 30 response models down to about 7 or 8, and it simplified the process. And then even we still have some things that we're working on. Nothing is perfect. I talked to one of our captains yesterday, and I say, hey, give me your top 3. I'm giving this presentation. What are your top 3 things that you have on your list that need to be fixed? And so I'm going to be working with Shannon on that. But the one I am going to talk about is us transitioning over to REMSA dispatch. When we have a call that has a law enforcement component to it, we've got to figure out a better way to get that information to our crews for their safety. When we were with Washoe, we had that information right then and there, right? Because they dispatch for the sheriff's office as well. So we have to work with their staff and figure out some different processes so our staff is getting that information. The other one was the EMD rollover process. So if we have a call that rolls over to Washoe, system is busy, they'll EMD a call for us, but we don't get that information all the way back for our crews, so we have to figure out a different system or process for that. So we'll need to reach out to our partners and figure out what we can do to improve service for our internal customers on the line. The reason I'm bringing that up is that nothing is perfect. We're still growing, we're still learning, and we're still trying to make things better. So I'll go ahead and turn it over to Shannon.
So some of the things that REMSA did for the growth on this is REMSA recruited and hired a new dispatch center director, myself. I was able to bring 20 years of police, fire, medical, dispatching experience. I've done consolidations, deconsolidations, lots of things that everybody wants to try to do to make dispatch best for their community. And so I was able to use my experience to come in and pinpoint where some of the deficiencies or areas of improvement were between TM and REMSA, and I think we've done a good job communicating that. One of the major points of frustration from the fire side when we had that all-hands meeting just to kind of see what it was that needed to be improved was the responders wanted to have a second fire dispatcher available to them for those large incidents like a structure fire, or wildland fire, or a large traffic accident, because those incidents get moved over to another radio channel to leave the main radio channel open for the day-to-day activities that are going on, and they can talk and do all of the things that they need to do to accomplish the job out in the field. And so I took that back and made sure that we had a dedicated secondary fire dispatcher available for TM at all times. And although sometimes it still is not staffed right in that very moment, it's typically because that secondary dispatcher is the one that's currently taking the call for that fire, and as soon as they hang up or as soon as somebody else can come over and take that console, they have that second dispatcher. So about 90% of the time they have that secondary dispatcher right away. REMSA is very receptive to the change in ideas to improve dispatch service delivery methods to TM. I have a philosophy that we serve TM, we serve the people that we're dispatching for, so we serve TM, and the things that they are wanting to do for their crew members and for the community, we have to figure out. I have to figure out how to get that done for them. And so anytime they come to me with a change or improvement, the answer is not no. The answer is either yes, or let's figure out how we can accomplish this together, which goes along to the adaptability to changes in their ambulance, in TM's ambulance deployment. This occurred before I got there, so I can't take credit for this, but developing the contract between TM and REMSA to have the ambulances in the jurisdictions that are sort of on the outskirts but have a high call volume, it helps support REMSA, and it also helps TM to contribute as best they can to the community. And some of the other things that we do integrated staff training between TM staff and REMSA dispatch. So we go, REMSA dispatch, TM dispatch goes out to the field when they're doing their trainings with Sparks or Reno or just their own specific field trainings. And so we can be a dispatcher out there on the fire ground, seeing what they're doing, and the best dispatchers understand what's going on out there so that they can anticipate the need of the responders when they're in the dispatch center and the incident is occurring. We also bring TM staff into the academies for new dispatchers. So every new dispatcher goes through phases of the academy for call taking, dispatching, REMSA dispatching, and so it is important for the dispatch trainees in the academy to get the perspective and some of the training and education from the responders themselves, because they're a better teacher than anybody in the dispatch center is going to be. And that also helps to build the relationships and know the faces and know the names, and in that they can, the captains can call in when something doesn't go right or when something went great. They can call in and have that interaction with the dispatcher, and it just helps us to keep growing and becoming better together. Dispatchers go out on ride-alongs in the fire engines, again, so that they can see what happens out there, not just on calls, but station life. When the responders are at the station, they can see how they live, how they clean, how they cook, how they train together even while at the station, so it gives us a better understanding of what's going on out there. And again, TM also comes in to REMSA and they do sit-alongs. There's certain things that they can learn from how the call comes in, what we send. When you guys are, when they're out in the field and they're making multiple requests, they can see how those are handled and why sometimes it takes a minute to get to the third task that you've asked for. That also helps to develop that camaraderie and understanding. We work together to instill guidelines or create policies that REMSA is able to sorry, I lost my train of thought. We work together to build the policies, and that is helpful because the field doesn't always understand what REMSA is capable of, and REMSA doesn't always understand what the field needs. So when we're together making these policies together, it works out best so that we can interpret it to each side of our teams. We have meetings every month with division chief, training officers at REMSA, management, and also the union president is invited to attend those meetings as well as the captain. And we can talk about the issues that came up over the month and develop strategies on how to, again, continue to make improvements and also talk about some of the successes. And with the enhanced aid areas, like he was saying a few minutes ago, there were some discrepancies in the beginning. We have been able to improve that process and also enhance it going along with the city of Reno in some ways because REMSA Dispatch has become so proficient in it and they have such a good understanding with it. TM has been able to expand that because of the trust in what can be done. Annually, REMSA dispatches over 13,000 incidents for Truckee Meadows Fire. REMSA as a whole dispatches 92,000 incidents, and inbound and outbound phone calls are about over 243,000 calls per year, and as you can see, that is a lot. And that's just at REMSA. That doesn't include, just think of across the county, how many phone calls are going in and out every day.
So before I move on to this slide, all that growth and development and lessons learned, he's not going to be happy that I'm going to say this, but he is sitting right in the front row for you. So Chief Joe Shum is our lead on that and helping create those programs and processes and policy changes and the issues from staff and working directly with Shannon to improve the processes. And I just want to acknowledge him and all the hard work that he has done to try and make it better for everyone and including the citizens. So, a little bit about the complexities for Truckee Meadows Fire. We have numerous agreements with numerous agencies because we border a lot of different agencies. Some of them are listed up there: Carson, Reno, Sparks, Story County. We have automatic aid with all those agencies, but the enhanced areas is kind of where I want to focus. We talked about that whole goal is that single apparatus response, even though we do send greater alarms. But we have an enhanced aid with Story County, Pyramid Lake, North Lyon on the I-80 corridor. We also have enhanced areas with North Lake Tahoe on the Mount Rose Summit, and then also with the city of Sparks in multiple areas. We talk about Sparks a lot, but we do this with multiple agencies. And when we have more significant wildland fires, that whole incident, once the initial alarm is rang down, initial resources are requested, and it's usually Reno, Sparks, Carson City, Story County, North Lake Tahoe, that whole incident moves to a different dispatch center, Minden Dispatch off of Johnson Lane. And we do that for single point ordering with all of our federal partners because they're on automatic aid responses to all of our incidents because we border all those areas. The reason I'm bringing this up is that you have to make multiple phone calls to multiple agencies that are on different CAD systems. And if you want to be, if we contract with a vendor, right, for services, you have to be able to do that. If you cannot or are not willing to do that, we will not move towards that center. You have to be able to make multiple phone calls between different centers that are on different CADs to share the information. That's why I'm bringing it up. And then the next one will kind of go into some of those complexities with enhanced aid and automatic aid.
So this is a overview as big as the picture that we could get that kind of shows you where auto and enhanced aid is in the region and where it is not. So the areas that have the slash marks, those are auto aid areas. It's a little bit difficult on here to see, but you can see the northern part of Sparks has the slash marks, the southern part of Reno, and then the outskirts in like the Stead and Verdi area. Really, it's everywhere in the populous area in the region except for the south end of Sparks and districts 1 through 10 in the city of Reno. So everywhere else we're participating in auto aid because it makes the most sense. Now I'm going to go through some slides and kind of give an example of how this works in each one of the areas and explain it a little bit. And if you have questions about how the auto aid and enhanced aid works, please let me know. So this is a close-up of Sparks. You can see the fire stations in there. I don't know if you guys can see this, but. So Sparks Station 5 is here, Sparks Station 4 is here, and then Truckee Meadows Station 45 in Sun Valley is here, and Truckee Meadows Station 46 in Spanish Springs is up here. The different colors represent the different purposes in the area. So the teal color is the jurisdiction of the city of Sparks, but it is one of those enhanced aid areas. And enhanced aid is where Truckee Meadows is saying we are the closest first in responder to this area, and we are going to respond to this area as if it was in Truckee Meadows jurisdiction. There are some areas in the city of Sparks that have the same thing. So there's some yellow area down here and this yellow area over here, and there's also some more down here that is actually county property, but the city of Sparks is the closest responder to that. So that is, again, another enhanced aid area where there's no questions, and CADs are programmed to say, even though this is Sparks, TM is responding to it, or even though this is county property, Sparks is gonna handle this call. And the purpose for that is, well, I'll just explain a little bit on the dispatching side of it. So when a call comes in, the primary PSAP is always going to be the first one to receive a 911 call. And the purpose of that is 911 was set up so that 911 calls will always go to law enforcement first for safety. Safety of the people on scene, safety of the responders. They need to see if there's any threat prior to dealing with the situation. So all 911 calls go to law enforcement first. There are dispatch centers like the city of Reno who do it all, police and fire. There are dispatch centers across the country like NYPD, New York Fire Department, LAPD, LA Fire Department, where they have a primary and a secondary dispatch center. The primary dispatch center does the police stuff. They figure out if it needs fire or medical. If it does, then they transfer it over to the secondary PSAP, which is what REMSA is. REMSA is a secondary PSAP. And so they transfer the calls to them because of the amount of calls that come in, because of the expertise. There's many reasons why you have a primary and secondary PSAP. So when a call comes into one of these enhanced areas, so let's say there's a call that comes into Sparks Dispatch because it's 911, it goes to police first. The city of Sparks receives that call, they put in the address, they learn that it's either a fire or medical call, and even though that is the city of Sparks dirt, their computer tells them this call is an enhanced aid area, and they will transfer the caller to us, and we will process the call. Then we will dispatch out Engine 46 because that's the closest unit that's going to be responding there. And the call is done just as like if it was in Truckee Meadows jurisdiction to begin with. Now, if Engine 46 is not available, the same call taking process happens. Sparks gets it, they recognize it, they send it over to us, we process the call. If Engine 46 is not available, we will send Engine 45 from Sun Valley just to make sure somebody is going. And then we will immediately call the city of Sparks and say, hey, Engine 46 is not available, do you have somebody that's closer? All this time, Engine 45 is going to make sure somebody's going. If they do, they'll send them, and then Engine 45 and whatever engine they send will talk to each other on the radio and determine who is the closest and who will continue and who will cancel. If they don't have a closer engine to respond, they will say no, and we will just tell Engine 45, you're handling this call. That's how enhanced aid works. Automatic aid is a little bit different. So automatic aid is the areas in green, and there is some pink, I think. Yeah, there is pink. So AT areas and AS areas, automatic aid for this region of TM and automatic aid for the city of Sparks. So the green area is the city of Sparks, where TM will respond second because TM is the second closest engine to that area. So if there was a call for Sparks Fire Station 5 and Sparks Engine 5 was not available, Sparks will process that call. They will take all of the information from the call taker and then learn that Engine 5 is not available. Then they will automatically call TM and say, hey, Engine 5 is not available. Can you send Engine 46 to this call? And we will put the call in, we will send Engine 46. That's how automatic aid works for the city of Sparks. We do the same thing in the top half of Spanish Springs and in Sun Valley. If Engine 45 was not available in Sun Valley, we would call Sparks and say, hey, Engine 45 is not available. Is Engine 4 available? Is Engine 2 available? And then we will get the next closest, because it's closer for Engine 2 or 4 to respond to Sun Valley second in than it is for Engine 46 to respond from Sun Valley. Any questions on auto aid or enhanced aid with Sparks?
Are you going to go over what Hexagon's going to do? Because won't you be able to see the engines?
We haven't, as a region, decided exactly what we are going to do with Hexagon.
Okay.
Currently, the conversations are essentially status quo until we figure out all of the ins and outs, with a little bit of change for the city of Reno, but I'll go over that when I go to the next couple slides for Reno. But any questions on this? So this is one area of the city of Reno. This is in the Stead, Lemon Valley, Cold Springs area. This was one of the areas where a award was presented today for the baby and that was from Station 44. So Truckee Meadows Station 44 is here by the golf course. In Cold Springs, you have Truckee Meadows Station 42 in Cold Springs, and then Reno Station 9 up here by the Stead Airport. And this is a vast area that's growing with limited fire resources out there. And so that's why auto aid in this area is a big help, because just the time that it takes to get to calls. So the way that medical calls are received by TM in these areas is REMSA already process all of the medical calls in the county. So anytime a call comes in, we know automatically wherever it's at if TM needs to respond to it as auto aid, or if it's not something that TM needs to respond to. So medical calls, there's no difference. There's no extra calls, nothing. We know that they're there, and we send along with REMSA. For fire-related calls in these areas, the city of Reno will process the call, and then they will call Truckee Meadows. And fire-related calls are fires, alarms, floods, things that just the fire department respond to that don't need an ambulance. So the city of Reno will process those calls, and dispatcher to dispatcher, not involving a call taker, but dispatcher to dispatcher, they call specific telephone lines and say, hey, Engine 9 is responding to this call. Can you send Engine 44? And currently we dual respond. So in Sparks, only one engine from either area goes unless somebody's not available. In the city of Reno, every single call, we dual respond. And so let's say that there is a call in Reno District 9, which is the gray area where Station 44 and Station 9 both reside. TM will dispatch, Reno will dispatch. This is for fire and medical calls. Every single call in those areas that are auto aid. So we will both dispatch, and whoever's jurisdiction it is, that's the radio frequency that both engines will go to. So if it is instead, they will both go over to the city of Reno's radio. They will talk to each other. They will say who is closer and who's going to continue and who's going to cancel. The opposite would happen for TM. So if it is in an area in Cold Springs that is TM's jurisdiction, they will both talk to each other on the radio and say, I'm closer or you're closer on TM's radio frequency. The dispatchers have been doing an amazing job dispatching dual units. We've been looking at the times on it. The times are amazing. There's always room for improvement, but the dispatchers are doing such an amazing job at both Reno and REMSA for this. So I just wanted to give that. Any questions on how it works with Reno?
I'm not seeing any. Okay, Commissioner Andrew.
Thank you. On the dual response, at what point is it the closest then that will call off the other if it's not needed?
Yes. So let's say, for example, there is a call instead on the 395. Just looking at that picture, you're going to assume that TM Station 44 is the closest. And so if they were both responding from the station, they will both go to the Reno radio frequency. Engine 44 and Engine 9 will talk together. Engine 44 will say, we're coming from station, you guys can cancel. So then Engine 44 will stay on Reno's frequency and run the call, and 9 will go back to their station.
Thank you.
And this is one of the areas that Hexagon will bring improvement almost immediately, because we can see all of the units, and we won't have to double dispatch. We'll
Okay.
just be sending the closest unit. That's the only change that we have so far with Hexagon. This is the south end of Washoe Valley, and I wanted to just point this out too, because this is another hot area where the auto aid is a huge benefit. Because as you can see, Reno Station 12 is right here in the middle, and they cover this whole area for the city of Reno. And once engine 12 is on a call, their next closest engine is gonna be Station 6. And if there were 2 calls down here, it's gonna take Station 6 a long time to get down there, but we have engine 36 and engine 33 that are much closer. So that is a huge benefit to that area. We have to work together to be able to serve the community here with the resources that we have.
So you brought up Hexagon. I'm glad you did, because it was part of this. I've heard a lot, the Hexagon CAD. I heard it yesterday during some of the county interviews, and I also heard it during the joint meeting. And I kind of want to give my viewpoint on Hexagon. We're using that platform for all the dispatch agencies, which is, we're already moving towards that regional approach, right? In theory, everybody's supposed to be able to see the calls at the same time. The information sharing is going to be there. Less phone calls. We'll have the AVL, opportunities to see where all the units are, and to kind of work towards dispatching the closest units. It is not the cure-all, and that is where I think some of the confusion is that the box has been checked. We have Hexagon. We don't need to talk about dispatch anymore. My opinion is that's wrong. Federal Engineering came in and did a study. They put 16 recommendations within that study. A lot of the earlier recommendations were what could we do with the processes that we have now? What can we fix now in the systems that we have now? And the other ones kind of focused on Hexagon and that being implemented, and then looking at closest unit and those types of things. That final phase of that recommendation talks about consolidation. Consolidating either 911 call answering services, the call processing, and using that to the fullest extent in the region, and also possibly consolidating those dispatch centers. So the reason that I'm bringing it up is I don't want everyone to think, well, since we have Hexagon, it's going to fix everything. We need to go back to that study. We need to direct staff to look at what recommendations are left, and what do the policymakers want to move forward with to try and still improve service to the region. I think it's really important, and I just wanted to make sure that you were all aware that I think Hexagon's going to be great, but it is not the cure-all for everything, unless that is what the policymakers want. They want to leave it status quo with 4 PSAPs, and because we have a CAD platform that we can utilize and everyone can get information, then yes, that's as regionalized as we're going to get. I think there's room for more, though. And so I know you probably have a lot of questions, and I know this was a lot of information, and we're willing to meet afterwards too, or at a later date if you have more questions, but is there anything that we can answer for you?
Well, I think that was a really great, just baseline, so we're all on the same page, especially since we started doing this automatic aid agreement with Reno in the north and the south. So thank you for that. I'll go down the line for the board and see what the questions are. Vice Chair Herman, Commissioner Garcia.
No questions. I really appreciated the historical context. I think Clark, Andriola, and I mean, a lot of the pain points happened before we were on this body. And so understanding when we stepped into this role, there were still rumblings about questions here, dissatisfaction here. Shannon, I remember when you were hired and when you came on board, so I know that's really greatly helped with the communication and the collaboration across the agency, so thank you. So other than just this being very informative, comprehensive, and thank you, are these slides available to us? Are they going to be emailed to us? Okay.
Yes.
I would really appreciate that, just so that we have something to refer to. So I appreciate kind of the body of knowledge that you put into these slides. I'm supportive of the Regional Dispatch Center. I'd love to hear what that looks like, how we can help, what that entails. Shannon, you've seen this play out in different jurisdictions. Anything we can learn from other states. It's still muddy for me on how the logistics of that. So that's something maybe in the future that we can learn a little bit more about. But other than that, just very helpful today, and thank you for your partnership.
Thank you, Commissioner Andriola.
I always feel like I want to do, I'll echo Commissioner Garcia's. You can see my notes. I was like, check, check. But I do want to extend a big thank you for a collaborative approach. And, you know, Shannon, the first time I met you, you've also exhibited saying yes first in terms of at least trying to figure out how to get there. And Chief Kettering, thank you for your leadership and for everyone who's involved. It's not just you two. It's a big process in terms of whether it's Sparks or Reno or TM or you. I think the fact that there is recognition of lessons learned, you know, and moving forward and what those adjustments are. And I think your message is loud and clear, because I think there is a little bit of a sentiment that Hexagon is going to fix everything, and it's not going to fix everything, but it's a step closer to being more efficient and being responsive in a more effective way to the community. And so it's going to be interesting to see like what that looks like. I was going to ask for the slides, so I'm happy that you're going to be sending them. And then the study that you referred to in terms of the 16 recommendations, is that available, just out of curiosity?
Yeah, it is public record. And
that would be great. If we could get that, I think that would be helpful. And I too am cloudy on exactly how this is going to work, but it sounds like there's, you know, experts and subject matter experts, right? And looking at what those best practices are going to be forthcoming. So we'll all be enjoying the clarity that's needed, and really the dedication of all jurisdictions to put people first and to put safety first and not get caught up sometimes in territorial things. I think we've already shared this many times, but I feel like I need to say it again. When somebody picks up the phone, they don't need to know about all of this. They need to know that whoever it is on their way, and it's a life-saving issue. And so the dedication for TM and the partnership with REMSA is clear, and I'm hopeful that we can get to a place where we can celebrate having everything in place, or at least the best we can. But it's clear we're moving forward. So I'll look forward to getting more information on the P25 at another time. And I look forward to, again, the collaboration is to be celebrated and commended. So thank you.
Thank you. Commissioner Clark.
Thank you, Madam Chair. I have no questions.
Okay.
Thank you.
I think it would be really interesting, and maybe we're not ready yet, but to get that call center presentation, and maybe we need to direct our future chief to start working on that, because I'm not sure where y'all are at on that.
So some thoughts.
Great, yes.
We already have, there's two working groups that are in existence looking at fire regionalization right now. And we've already talked about dispatch being the key to that. Right?
Okay.
You have to have dispatch first. And so we've already talked about that study, and that working group has the fire chiefs and the managers from all the entities, Sparks, Reno, Washoe County. And so maybe that's the start of just making sure that those managers know that, hey, we want a deeper dive into this, to look at those recommendations and then maybe bring something back. It needs to go back to all of the bodies, though. It needs to go to the city council members and as you as well. So I think maybe that's the start. And the other piece of the other working group, Chief Shum's working with his peers over at Sparks and Reno on the Hexagon piece of it for the response models based on what we can do regionally once Hexagon is up and live. Is it going to be a single response, multiple engine response, and looking at some of the disparities and how do we work through that as partners. And so I wanted to make sure that I got that out there. But that would be my recommendation. I think it's really key that we go back to that study. It was done in 2023. It has a little bit deeper dive than the prior studies, and look at that. And the last thing I do want to bring up, if it goes down the consolidation path, and I'm not pushing that one way or the other. This whole study was based on fire and EMS, not the law component of it. But there's been discussions that Truckee Meadows may, hinder a consolidation, and I want it on the record that there's 4 PSAPs in this area: City of Sparks, City of Reno, Washoe County, and REMSA. Those are the entities that can make a decision on consolidation or not. Truckee Meadows has to contract services for someone to dispatch for them. We do not have a vote. I have an opinion, and if anyone wants to hear it, I'll give it, but I don't have a vote. The policymakers are the ones that have to decide, are we going to do this? And so I just wanted to make that clear, because I've heard that a few times, that Truckee Meadows is hindering regionalization and consolidation. That's going to be up to the policymakers. So.
Absolutely, and I think it's a good reminder of, we need to make sure we're tasking our manager with looking at that and the future chief of what that call center could look like, and what those recommendations could come out, because I think that's necessary. And then when I was shadowing at our STED station, we don't respond, well, we respond to many more calls than Reno does because of policy differences. And so I think, we need to work that out as well. And I think the statistics show, we'll see in the chief's report, we're responding 4 to 1 to Reno calls.
I ran the data this morning. So Chief Shum and Mandel and Keller have done a really good job of trying to work through that and reduce some of those calls. So about 2.86 to 1 now. The last 2 months have been pretty consistent with that. So they've been able to make some changes and reduce it. It is something we do need to address. We did a 90-day trial where I think we're 140 days in now, something like that. And we're still dual dispatching, and it is kind of wearing on our staff a little bit. We made a commitment that we would make some changes, and so I don't know, maybe at the next board meeting we can bring some recommendations of and get some direction on what we need to do. And maybe, I don't want to even suggest this, but worst case scenario, maybe we just stop for now and get everything programmed in Hexagon, which is not what's best for the citizens.
It's not best.
That would be the worst case scenario.
Yeah.
But we have some in-between recommendations in there that we think that maybe we can work through. So, we'll bring that back at a later date.
That would be wonderful. I think the board would like to see that. So, okay. Well, with that, if there's no other board comments or questions.
I do apologize for the length.
Oh, no, I think that was I was engaged. DA Large.
Commissioner, just for clarification, I'll just on one aspect, this is not a legal question, but for curiosity's sake, when the city of Sparks or city of Reno are browning out stations, how does dispatch, does it change the dispatch on the calls at all in regard to that?
I don't believe so.
So I'm not aware of any stations being browned out at this point, but it's a 1-for-1. So if they moved somebody up to, let's say, Spark Station 5, then it doesn't matter who's there, they would go. It could have an impact if that station that is the closest to Truckee Meadows, who would give the aid, is not staffed. But I haven't experienced, we haven't experienced that yet. But yes, it could have an impact.
Okay.
Maybe not so much on the browned out because I'm not familiar with that, but I do know that we have trainings that we send our apparatus to. Hazmat training is usually long; it's about 4 hours, and we are supposed to coordinate with each other on the battalion chiefs ranks to let them know, hey, we're going to be gone. Can you cover this? And sometimes we forget, and they don't know we're there, but we're trying to do better at that. So there are some areas, times that we're not there, that they will pick up a lot of our calls for us, and vice versa.
All right. Well, yes, it's something to consider as budgets tighten, and we look forward to continuing the dialogue. And thank you for coming out, Shannon, and your commitment. All right. We're going to take a 10-minute break, so and we'll come back at 12:05. Thank you so much. Hello, everyone. I'll bring back to order our Board of Fire Commissioners meeting. We will now move on to item 11, Chief.
Item number 11 is the fire chief's report, and I'll try to make it brief since we're just over the 2-hour mark already. The community report is part of this, and that was prepared by Chief Moore. Thank you very much. Our capital projects update. The apparatus bay for Fire Station 37 is progressing on schedule and is expected to be completed by November of this year. Contractors are beginning to tie the house and the new addition together structurally. And the station crews work together with contractors to create some space alongside the RV bay to park our brush truck, which was a significant change as the original plan was for the brush truck to be absent from the station until construction was complete. We just hosted Station 35 groundbreaking next door to the Apple Data Center. Ironically, there was a vehicle accident on the freeway that morning directly across from the station site. At the same time as our ceremony illustrating our need for the new facility. The dirt work of the site has already been completed. We're awaiting some final documentation from Apple to move forward with other parts of the project. It's going to be the first station in the district with bay doors that open horizontally instead of vertically, which is a big difference and reduces maintenance needs and is faster opening. And it's still on schedule to be completed May of 2026. Apparatus update, quickly. We're still awaiting delivery of the 3 brush trucks, 1 Type 3 urban interface unit and 2 smaller Type 5 brush trucks. They're scheduled to arrive sometime fall or sooner. Our engine that was struck on the 580 freeway back in February has been delivered to a repair facility in Texas. Because of the extensive damage to the vehicle and how the body of the fire trucks are constructed, they still expect that repair process to take about 10 months. Fire Station 32 is, we're expecting that back around February of 26. Station 32 in Washoe Valley is currently operating with one of our reserve fire engines, so no loss of service to the community. And last on the report will be Senate Bill 319, which I think I've made everybody aware of where that's at. It did pass out of the Senate. It was taken down to just a study, and we're hearing that it may be heard in the Assembly on Thursday. And Part B of 11 is the monthly response stats for March 2025, and I'll let them stand unless there's any questions.
Wonderful. Any questions for the chief here? I'm not seeing any. All right, we will now move into item 12. Chief.
Item 12 is a recommendation to approve a revised and final Phase 3 memo of understanding between TM and Apple, which defines the agreement between the parties for funding of construction, construction management, commissioning, special inspections, and cost apportionment for for TM's portion for the additional bay and 2 additional sleeping quarters. Phase 3 includes an allocation of $1.4 million of estimated costs for the additional apparatus bay and those 2 sleeping quarters, not including amounts for furnitures, fixtures, and equipment. Total costs to be paid in fiscal year 2024, 2025, and fiscal year 2025-26 for possible action.
Thank you, Chief. And if you could remind us, on the Phase 2, was there a additional cost as well on this? Okay, this is the total cost of renegotiation with the Apple station.
Yes, this has gone back and forth several times.
Yes, okay. Looking to the board for any questions, Vice Chair Herman. Okay, Commissioner Garcia, Commissioner Andriola, Commissioner Clark, okay. Any public comment, Madam Clerk?
There is none.
Okay, then with that, I am looking for a motion from the board. Commissioner Andriola.
I'll move to approve a revised and final Phase 3 memorandum of understanding between TMF, PD, Washoe County, and Apple Inc., which defines the agreement between the parties for funding the construction, construction management, commissioning, special inspections, and cost appropriations for TMF PD's Fire Station 35.
Thank you. Looking for a second. Thank you, Commissioner Garcia. All those in favor, please say aye. Aye. Any opposed, please say nay. And I think that passes unanimously. It's on your screen. There it is. Okay, that motion passes unanimously. We'll now move into item 13. Chief.
Item number 13 is a recommendation to acknowledge the fact finder's non-binding decision from April 8th, 2025, in accordance with NRS 288.200, number 8, regarding our collective bargaining impasse between TM and the Truckee Meadows Fire District Firefighters Association, Local 2487, non-supervisory unit, and to approve the collective bargaining agreement between Truckee Meadows Fire Protection District and the Truckee Meadows Fire Protection District Firefighters Association, Local 2487. This is a 2-year retroactive term effective July 1, 2024 through June 30, 2026, with an estimated fiscal impact over the current collective bargaining agreement of about $2.3 million in fiscal year 2024-25, and an additional almost $1.7 million in fiscal year 25-26, for a total estimated fiscal impact over the 2 years, approximately $4 million. And if approved, authorize the chair to sign the negotiated agreement on behalf of the board for possible action.
Thank you very much. Are there any board questions on this? I don't see any. Any public comment, Madam Clerk?
There is none.
Okay, I'm looking for a motion on the agreement.
Madam Chair, move to approve.
Thank you. Looking for a second? Thank you, Vice Chair Herman. We have a motion and a second. All those in favor, please say aye. Aye. Any opposed, please say nay. And it's on there. All right, the motion passes unanimously. Thank you very much. We'll now move into item 14.
Item number 14 is a presentation and overview of the tentative budget with changes for fiscal year 25-26 regarding priorities and projects anticipated in the budget and possible recommendations to bring any board-directed changes back to the Board of Fire Commissioners for a public hearing and approval of the final budget for possible action. Ms. Cindy Vance, our CFO, will be presenting.
Welcome.
Thank you. Good morning, Commissioners. Okay. We'll go ahead and just go through the slides, and you can stop me with any questions. I did leave time for questions at the end, but it might be actually good to ask them as we go, and then after the general fund too. Okay. What we wanted to start with showing is our fund balance. This actually represents 3 funds. So it is our general fund, our capital fund, and what we call our vacation sick comp benefits fund. Those funds are only sourced through transfers from the general fund, those other 2. Now, the capital fund may have other incomes with like Apple and that, or some debt issuances, but it doesn't have their own dedicated revenue sources. So this shows from 2018 and our decline. The peak in 2020 is a bit of a partial. It's COVID, where we thought, we kind of put a brakes on a lot of spending there, but actually sales taxes and stuff went up. We also issued debt for apparatus at $4 million, so we got the proceeds, but we actually didn't get the apparatus in until fiscal year 21 and actually spend the money in 21. So that throws off that year a little bit. But we have been having a declining fund balance. A lot of that is because we had 40% fund balances and stuff, and that was purposeful, and those are extreme fund balances that you are either charging the public too much or not spending enough and providing services. So to look at the general fund to start with, property taxes are our highest source of revenues, and that represents about a little over 50% of our revenues. They're projected, which is currently at the budget because we are pretty flat, and we're running right at budget, and we only have another $1 million to be received. So give or take 10, 20,000, I think we're pretty close. And then the budget is developed by the state, and we use the state numbers. Okay. Our next significant source of revenues is our consolidated taxes. These are like liquor taxes and cigarette taxes and several different other taxes. Those have been a bit volatile. So those we were seeing like 10 and 15% increases during the COVID time, but now they've slowed down and we actually had seen some decreases. We had hit 12 million before and then back down to 11 million. Currently, we're projecting that we will collect the state's projection for fiscal year 25. One of the things the state has done is they've implemented a new billing system, so that is throwing off our projections, where we had November was only a partial payment, but instead of making up that payment, they're adding it to the payments, the future payments, so it's hard to tell, are we really collecting more, or is that extra really just collecting what we were owed in November? And so it's making that fiscal projection a little harder, but we are still hoping that we, and using that projection, that we will collect what we budgeted. And give or take a few tens of thousands, which, you know. And then the budget is used from the state of 12 million for consolidated taxes for fiscal year 26. And that's something we're definitely going to have to watch closely with the economy and the turmoils. I mean, it's not a very predictive economy right now, so we're going to certainly have to be watching our budget really, really close and making sure those numbers come in as we especially bring down that fund balance a little more if we go forward with this. So 76% of our revenues are property taxes and consolidated taxes. All other revenues are make up about 23%. A lot of this is some of the fuels revenue, so reimbursements or charges for services for fuels work with NV Energy or different programs, SNPLMA. Some of that is federal revenues. And that can be volatile, so depending on the year. And one of the things with the fuels programs, if we don't have the staff to do the work, we don't get the revenue either. Okay. So our total revenues are projected at about 50 million this year, and 54 million is the budget that we plan to present next in 2 weeks. Okay. And that is an increase of about 8% over last year. So let's see. On the expenditure side, salaries and wages, when we look at our budget, when we build our budget, we do work with our staff and each department to talk about what they are doing for the rest of the year, what they want to do for the next year, and we use that to project out the rest of the year. When we budget originally, especially for fiscal year 25, we budgeted 100% for all of our open positions. So we will see some savings. The 26 million is what we think we'll actually spend, because some of those, that does represent some savings from vacant positions. Employee benefits at 16 million, services and supplies, which only represents 14% of our budget. So 85% of our budget is salaries and benefits. It's what we do. Capital outlay and debt service, and this says it excludes transfers to debt services. This is more of an accounting rule because we have to present some software subscriptions and some operating leases as debt. So it really is just the operating lease we have for Verdi and some software subscriptions that are required to be presented as debt payments. Okay. So our total expenditures before transfers, 51 million in the current year. When we look at budget year, salaries, we have a fairly flat amount. The union agreement we just proposed, most of that salary, obviously, that salary increases is occurring in fiscal year 25. It's a 0% increase. We'll actually see a slight decrease because of PERS. So that's why that looks so flat. That's one of the biggest reasons. And then we also are not funding certain positions. When we're running at 192 positions currently. We are adding 6 more positions for part-time interim for fuels work, which are 93% funded through other sources and bring in revenue. And now that does include the executive management office manager position. So that position is not new. We're not adding any additional positions. Just it is in there, and it was included in the budget before bringing it to Truckee Meadows, but it was included as a payment to Washoe County instead of a direct payment from us to them. And then just the reclassification of the salary by reviewing the position. So reviewing the position as it was with Washoe County versus what that position is responsible for now and will be doing for Truckee Meadows.
Yes, Commissioner Andreola.
So thanks for clarifying it, because I just pulled up the consent item, and it shows, at least this is how it reads.
Yeah.
Oh, you know where I'm going?
I don't know for sure, but I
Okay.
think we'll let you.
No, that's okay.
Yeah, because it has the 108. Yeah.
It just shows that half of what you said and then half of what you didn't. So here's where I'm just trying to figure this out. I understand what you're saying in terms of the position itself was actually paid by Washoe County, and now essentially it's moving into TM.
Correct.
So I'm hearing you on
Perfect.
that. Okay. But then it says, and then it'll unfreeze and reclassify, and then it'll create a vacant position of an executive assistant, and that's what was throwing me. So it's specifically saying for a new executive office manager position, and then to unfreeze and reclassify the vacant position of the executive assistant. So I just wasn't sure, is that two positions now, or is it just one position? And so I
We've had that, and we have an executive assistant position, but it's frozen because we're paying for it through Washoe County. So for the process, they have to unfreeze that position where it becomes vacant, and then they'll appoint Sandy to that position.
To the executive assistant?
Yeah. So it's kind of we'll unfreeze it, reclassify it because of the study, because it's been sitting there for years frozen, and then we would move Sandy in there and stop paying the county for it.
Okay.
Sorry.
So where does the executive office manager come in? Where is that position?
That will be that position. So it is the executive assistant. It will stop being this executive assistant. It will become the executive office manager, but same position.
At the end of the day, it's one position. Is that what
Correct.
I'm hearing?
Yes. At the end of the day, it's no new positions. We're not paying for any additional positions. We have one more new position because now it's in TM and out of Washoe County.
But I thought I heard the chief, to back up Commissioner Andreola, say that there is a position, an additional executive assistant position that is frozen.
We have one that is frozen.
That just has nothing to do with this.
Well, it's the one that we're using to move the position to us. And maybe, yeah.
Coming up.
Nope.
Like, how confusing. Sorry.
It's confusing.
For the record, Carla Ribiaga, HR manager. What it is we have an executive assistant position that was put into TM probably 2 years ago, that was ironically reclassed from an administrative assistant to an executive assistant, because we thought at that time Sandy was going to change over. Sandy didn't change over at that time, so that executive assistant position is now being reclassed to the executive office manager. My typo in the staff report I'm reading, why you're confused. It is literally a position that already exists. We want to unfreeze the executive office or executive assistant. We will reclass it, and it will become I'm trying to remember titles, executive office manager. So it's one position that will be unfroze, reclassed. Sandy will go into it.
So no additional positions.
It's just unfreezing one that exists. We're going to have her come over from the county, quit funding the county. So she's just basically, we're picking her up at the county, and we're dropping her into TM in a position that already existed that will be reclassed. So executive assistant will now be called executive office manager.
And
that position will disappear. The executive assistant will not
Okay.
exist.
That helps, and I apologize. I'm not trying
that's
to
okay.
just
I
pinpoint
appreciate
this, but it was confusing just getting a little bit, but I'm clear now. So the reclassification will then have an increase on the budget. So it isn't just a straight transfer from Washoe County to TM. It's a position that essentially is going to go away, these are my words, as an executive assistant and be reclassified as an executive office manager for a higher salary.
Accurate, yes.
Okay,
we did
I'm just
work very
making sure I'm
steady on it.
understanding that, and the higher salary that the executive office manager is reflected in the current budget that you're presenting.
Yes, it is.
Okay. Okay, sorry to have taken up so much time. I just wanted to make sure I understood.
Madam Chair, I also had a item for clarification on the salary and wages. Did I hear you correct when you said the projected, the FY26 budget has the salary savings already baked into that number?
Yes, for the positions that, and we do have a slide later of what because we went through and funding all the positions was not available that everybody wants. And then we have some items that were already vacant. So if we don't refill them, that's how we're going to offset some of the costs. So when we started with everything, we start with here's everybody's salary, and we put it in the schedule, and we're negative. So, and then we go through. So the salary savings that we will show in a future slide is already included in these numbers. We've already implemented those. So this is the after that, just to clarify. So doing those will not make this any better. Or any less worse? I don't know.
Commissioner Clark, did you have a question?
Yes, thank you, Madam Chair. Maybe in the future we could have some type of an organizational chart to show us this, and maybe we could cut to the chase a lot quicker. Seems like we've been going around for 10, 15 minutes on this, but more importantly, one job is going to be transferred and with an increase in pay. What's the exact number for the increase in pay?
I don't have that staff report, but I think it was about 13,000.
So in the future, when you're doing these kind of reports, and not to pick on you, bring that stuff, okay? We want to see that. People like me are going to ask those kind of questions. So what's the exact number of the pay increase?
And we do have that, and I'll let Carla get that, and then she can bring that up too, please. One of the significant increases that we're seeing from projected to budget year are really in the employee benefits. PERS increase is 8.75 actually, and then for police fire, which is a majority of our employees. One of the things we did add into the agreements on all the negotiated agreements was a partial offset of that. So TM, and I do have more details later, but TM will take on about 5.3, and then there'll be a salary reduction or offset of the COLAs for part of the PERS. So that is, we did not get that till like November, December last year, so we already into the negotiations and stuff, so we didn't take we did add the partial offset in it because we have seen such big increases, but that was by far much larger than we expected, and it kind of comes as almost like an unfunded mandate is we have to pay that and come up with a way. Okay. So, let me get that. Okay. And I'll, Carla?
Carla Ribiaga, for the record. So the salary is going to go from the max previously being $92,996 to now $108,201. So the increase is $15,204.80. Good.
$15,200.
$15,204.80, which is $12.67 a month and $7.31 an hour.
So that's going to increase the cost of the budget of $15,000, $15,204.80.
It is included in the budget currently, but yes, it is an increase over a prior year.
So just want to get this out
Yes.
get it on the record. You know, we're all looking at a budgetary problems here. The city of Reno, the city of Sparks, the county, the fire district, everybody, and yet we're looking at, and we've got other departments here in the county that are looking for this type of very thing, and they're all being told no. So I just want to know how this particular situation rises to the level of you're going to get it and others don't get it. Again, you mentioned that it was 85% of the budget is salaries.
Correct.
There's going to be a point in time when somebody has to stand up and say, we need to, there's only one way to cut the budget, is that's when the most expensive item on the budget is employee costs, benefits, payroll. So when do we start that? After this or before this, or after we get ours and everybody else doesn't get to get the raises? So I'm just throwing that out, not picking on you, but I need to get that on the record. We need to start being fiscally responsible. If they're doing the job they're doing now, maybe they don't need a $15,000 a year raise to continue doing the job. And I'm just want everybody to understand that. Thank you.
Chair, may I just?
Yes.
I just, again, I feel bad staying on this, but I do think it would be remiss of me to walk away and not share this point, that it is tough times ahead.
Yes.
I mean, your first slide is not a fun slide to see from 2018 to what is happening. And I think if everyone's tightening their belts, it's hard, right?
Correct.
So I'm just wondering, and then we have a new chief coming in, and then we have, this is just an interim budget. This isn't the final. I guess what I'm getting at is there's two, because of the tabling of the, pulling the consent item out of the agenda, there's two motions that I'm sure need to be made when the time is right. And I feel like the motion for approving this position really, I think, can be tabled until the new chief comes in.
Okay.
Because it's a direct relationship to the chief. And so I don't know what the body is going to feel like. I'm just sharing that as for consideration. Everyone should be compensated for the work they're doing. It's not in that vein that I make that comment, but I do think it's a short period of time and everything's going to be looked at, and I think that is an important thing that I felt that I really needed to share and where I was coming from. The clarification on the two positions was super helpful, so I do really appreciate that. But I would just throw out my last comment of essentially where I'm coming from in terms of seeing that it's not a very rosy picture ahead. So
correct.
And I think for my point of view, I like reclasses to be in the budget. So I'm happy to give you direction to fold this into this budget.
Okay.
And make this a part of the 25-26 budget. Because that's when we're doing the planning and that's when we're having these discussions. So that's where I'm at.
Okay.
I'm okay with that recommendation. I understand working out of your classification. I have done that before, and it makes you angry as an employee. And we have just earlier, we now have closed all of our agreements with all of our bargaining units, and we've made, I feel like, our staff whole.
Yes.
And so I think I don't want to just pull out one position of $15,000. I think it's fine that we fold it into the budget. I just don't necessarily want to see reclasses outside the budget because we're looking at this big picture. That's where I'm at, and that's where I've been at with the county as well. If we do reclasses, I want it to be within a department's budget, and it's a zero, balance to the county. But anyway, I'm okay proceeding, with, that's where I would go today, is like giving you direction to move forward with that recommendation in the budget, but not necessarily starting in May. So
Okay.
starting in July.
Okay.
Any other comments on that as we go through this presentation? Okay, go ahead.
And currently, just these numbers do show that for the July, and it does have the May portion in it. Okay.
Which is 2 months, and it's not
Yeah.
a big deal, but
Correct.
anyway.
So our total expenditures are $53,853,000. And if you'll notice, that's actually not as big of a percentage difference. Of course, we haven't shown the transfers out as our revenues are increasing, but we have been presenting a budget that was spending more than taking in for several years, but purposely, again, with 40% fund balances, we should be spending that down, our balance of between saving and providing the services and the needed things. So I think we use a lot for apparatus or building of stations, but then we also have programs that we put into place. Okay. The next slide does show our projected fund balance. So the projected on fiscal year 25 is the actual. That's where we did end in fiscal year 24 and started with in the 25. Now, the original fiscal year 25 budget had a $10 million starting fund balance. So we did miss that by $1 million. But we've made it up through other, whether it's additional revenues and expenditures. So we have our revenues of $50 million, our expenditures of $51 million. Our other financing sources with contingencies and transfers, that includes transfers to the capital fund, transfers to the emergency fund, transfers to the sick and vacation sick benefits fund. With a projected ending fund balance of $5.3 million, currently, we budgeted for a $5.2 million. So we are close to budget, slightly over in our projection of where we were this time last year. Okay. So for our fiscal year 26 budget, we would be starting with that projected ending fund balance. Our revenues of the $54,900,000, our expenditures at $53,800,000, and then our other financing uses and transfers. So we do keep a $400,000 contingency line item in the general fund. We did use some of it to transfer to the emergency fund during the year. And we also use some for the executive search. So certain things that come up that we couldn't foresee, it's an extra line item. Now, $400,000 has been the amount for, I think, at least the last 5 or 6 years. So we've gotten expenditures that are growing, and we haven't really grown that account. But we also have about $1.4 million into capital that we'll look at, and $750,000 to that vacation sick comp benefits fund, and $1.3 million in our debt, and that just equals our debt payments, which is a projected fund balance of 2.2. It's just over 4% of the current year expenditures, of that budget year expenditures. It's a sensitive budget, I guess. But I know we're bringing, everybody's kind of in that same situation with the declining revenues. And we met a lot of the cost of livings increases with our in the last few years. So those have outpaced our revenues, especially when our revenues are slowing. And I'm included in that group. So. The significant items to kind of go over that will be presented in the final budget. Right now, these numbers equal what we think we will bring in 2 days. We're not expecting any changes except for what direction we give here, or if anything else is slightly noted, and we would make sure to bring that back in 2 weeks. But consolidated taxes kind of flat or minimal increases. They've been about 2.5% to 3%, where we were seeing 10% before. Capital needs, especially the cost and the lead times of capital needs are growing. We do have some, we're trying to set up funds so that we can really address that in a prospective way instead of reactive way. Of course, our negotiated employee contracts, those all have to be in there, and that's, again, our biggest cost is for all employees, and then our PERS increases. So 8.75% was police fire, 3.25% for regular. So the split is anybody in police fire will actually take a they'll get their COLA on July 1 if it's scheduled. And then on July 14th, because of the dates that aligns with PERS, they will be reduced by 2.88% to be for the salary increase, or the PERS, to kind of offset the PERS. It's their portion of the PERS that they will pay. The way that also works from the PERS side is there's a number factor, and that number factor grows, so it takes into account on their future benefits that they took a salary reduction. So when they look at what their salary was over the whole year, they take that into account, and they'll increase the salary when they estimate their PERS benefits. The split for regular was anything over 2%. So the split for police fire, the way we wrote it is, 3%, we will, anything over 3% we split. So the county, the district takes on 3% plus half of the other 5.5%. And then the employees will take the other part of that split in a salary reduction. For regular, it was 2%, so it ends up in a salary reduction of 0.62% for that group, and then district will take 2.63 of that. So our cost-saving measures that we went through to bring this what we're presenting here is we have 2 fire prevention positions that are vacant that we are not going to fill until January. 1 mechanic position that actually has been vacant, and we're going to leave it vacant. There's 4 firefighter positions and 3 captain positions that will be vacant or will be, because we have known retirements. And some of them some will roll up, and some of the captain positions will leave open. The 2 fire prevention positions, about $130,000 saved for a year. Mechanic positions about $130,000 for the whole year, and the firefighter captain positions is about $806,000 estimated savings for the year. Reallocating the 4th person from engines at the stations number 40 and 42, that's about $840,000 in overtime costs or staffing costs for those if we do not run the 4th person. And we put a 1-year pause on program budget. So the wet team and hazmat teams had individual budgets for training. But we do have in the contract the ability for them to use up to $750 a year for training. So we asked them to get the training using that program. The dozer program, REMS, those are also similar type programs, or whether they're done for to take the dozer. I'm not too familiar with them. And the rapid extraction. And then AACT was a program with Washoe County School District that we would teach at and provide additional staff. So now we'll work with them, do it only as duty is available, but not as it fits in the current budget, with not an extra budget on it. 1-year pause on the green waste program. That's about $91,000. Pause on fall recruit class because we don't plan on doing any hires, so that's $185,000. And then we had other miscellaneous costs. We did bring in all department heads, we went through with them, but then we also did bring in the union, and that helped a lot too. And we went through line item by line item of every cost center, and they came up with some other options too, saw things that we didn't, so we're going to do some reduction in cell phones, spreading out of cleaning, bringing some of the cleaning in-house, and those kind of things. So I don't have a specific dollar, but it's probably $10,000 to $50,000 in just those type of reductions.
Madam Chair, may I just ask
Yes.
for clarification? I was writing down, and thanks so much for giving all this detail. I just want to go back really quick on the hold vacant approved positions, the 2 fire prevention positions. You mentioned approximately 130,000, the 1 mechanic, 130,000. The 4 firefighter positions, I got the 3 captain positions, but I missed.
That was those together.
Oh, that was those
Yeah,
together.
so
Okay.
806,000 is from those 7 positions.
Thank you.
Thank you. And then, doesn't fire prevention bring in revenue?
I'll let Chief Way answer that one. They do. Yes.
We can't. Right now, staffing is just 2 trainees. And I, obviously, in my interim role, haven't had a lot of time to work with them since our fire prevention captain decided to leave us at the end of last year. So yes, it can bring in some money.
You have 2 trainees right now.
Correct.
So you have 3 people in the department theoretically.
Yes.
Right now. And then a full department is 5 people.
Correct.
Okay. Got it. That's all my questions on that. Anyone else?
I
Yes,
have a question.
Okay, Commissioner Garcia and then Commissioner Clark.
On the 4th to last bullet point, you said the pause on program budgets, that was specifically for training?
Those can be used for training or different equipments, so they would need to use the equipment that they have. We would set aside about $25,000 for both each wet and hazmat to use as they needed, whether it was for overtime training or different supplies needs. So it's not that we're saying they can't do it, but we just need to fit it within. We're not going to budget the additional. It needs to fit in with the operations budget.
Understood. Thank you.
Commissioner Clark.
Thank you, Madam Chair, and I'm glad you brought up the fire prevention has the ability to generate some income. And then I want to ask you about the bulldozer that you brought up. Does that have the ability to generate some income for us? And what is the projection for that this year, approximately?
The DOZER program does. We send that out to other agencies and we can charge for it. So the DOZER, this would be like the extra training and stuff. So the DOZER would still be sent out and bring back money. I do not know. It's really hard to project on that specific one since it's just started and we're kind of seeing some of the revenues come through now from the last season, but it depends on how many agencies order it. I don't know if Chief Eisenhagen, has he left? Because he's done some analysis and had some thoughts on that, but it will depend on the ability to send it out. One of the things we have to watch too is between July, well, actually, we get our 3rd quarter tax payment is in March, and which is a really large one. Then the next one is very small, but then we don't get our first one until July. So the ability to send people out on in that period really between May and July is a cash flow problem, can be. But we want to earn the money, but we have to be able to pay the salaries of the additional overtime in advance to be able to collect that money. So I know we're doing a balancing act and calling that really month by month or even week by week of what's the money, what's the payroll, how quickly can we get them out and back in collections.
Sure. So I don't know if it's true or not, but what I've heard is that particular piece of equipment generated about $800,000 in the positive side last year. So, but if we don't have the ability to send it out for a couple of months, and that's kind of the start of fire season, how do we get that settled out so we're maximizing the ability to generate income as well?
I know that is something we are working with internally, and it is certainly a balancing act of having the money in advance. We're working with our external agencies. The state of Nevada is now paying quicker, and I have new staff, so I'm getting them trained to be able to enter the payments quicker. We're working with staff to make sure that they get the information back to us complete so that we can get their reimbursements out, but then also have it to request the reimbursements from the state. And I know that the state, working with the state, it's what they have too. If they run out of money, they put us on hold till they can make another request from the feds or from their different state departments. So at times we have seen that where we have the bills in, but we can't get the cash. It is definitely a balancing act, and there's a lot of change from our staff and from their staff to try to see where is that going to end, what is going to be our turnaround. Is it going to be 4 weeks? Is it going to be 6 weeks? But it has been closer to 6 months in the past, and we're hoping that changes. And I think in this next season is where we're going to really be able to refine that and define how long that takes.
So just another thought, if you know this is a balancing act and we know that the delay of payment can stretch from months to several months to longer, wouldn't it be prudent to have reserves set aside to handle this, tide you over until the money comes in? Is there any way to do that? Is there any way to look into that and see, come back to us with a proposal how we can do that?
And that's usually what we write off is the fund balance. So, but we will certainly discuss that and come back with the different cash flow proposals and how to monitor those and try to make the most of the revenue generating by putting the cash up front.
And we have a $5 million fund balance theoretically in
Correct.
this budget. Okay, Commissioner Garcia.
I'm curious about the implications of pausing our fall recruitment class, and maybe that's a better question for the chief. So we're talking about the academy, like for firefighters?
Chief Kettering, can you?
For the record, Chris Kettering, Deputy Chief. So yes, we are. We are moving forward with the recruitment process, and we'll go through the testing process and the assessment process. So if things in the budget turn around different, we can hire those individuals right away and get them to the academy. Or if not, if it's not the fall academy, then it'll be the spring academy if they have a second academy. But yes, we are holding on hiring any of those positions, and that would be the 4 firefighter positions. Okay. And then, if I'm here to answer your question, a little bit on the wet and hazmat programs and the dozer program. So currently with our hazmat program, we try to send everybody we can on duty to the hazmat trainings. We created an overtime budget for it because we have so many hazmat individuals and offered them to go off duty and we'd pay them overtime so we can try to capture everybody. So that's the account that we're going to eliminate. It sounds like maybe you might have heard from my staff meeting, it was $80,000, not $800,000. That's what I presented to our staff members. And that was an approximation, but we can get you an accurate number on how much money it is. And so when we send the dozer out, we bill for the equipment, the transport, the trailer, all that gets billed to the incident. The issue that we run into is, yes, we can build a nest egg to kind of protect that, but because of the delays that it takes, if you send the people out, you know you're going to get that revenue that may come in on the apparatus and the equipment, but if it takes a long time to get it back, you just keep eating it away. And so we need to balance that out a little bit more on what we send out. The positive parts about sending people out is that's how you're building the experience for this organization, and that was shown on the Davis Fire. All of our big players, the individual we gave an award to today, was here for that event. So it's definitely a balancing act. As for the REMS program, it's the same. So we have a pot of money that was set aside, I think it was $25,000 for training. We're going to have to reduce that this year, but we'll still send those units out when we can budgetarily and to get that experience, and then that will help. We can bill for that equipment going out. AACT program, what we used to do is we had an overtime budget. We would send instructors to that program on overtime. We're going to reduce that, and then we'll work with AACT, and if they need instructors, we will take an engine out of service and we will send it over to do that instruction for them. So those are some of the things. The wet and hazmat programs years ago, each individual per the collective bargaining agreement gets $750 as a training allowance, and that's how we used to do it in the past. And when times were good, we decided, hey, we want them to use that for other training, so we'll create overtime budgets for them to go and do that training here locally. And so we're going to try to go back to that $750 until we get through this, and then we'll look at those budgets in the future of getting the overtime budgets put in there.
And while you're here, Commissioner Garcia, do you have follow-up on that? Okay. The 4 firefighter positions, so you had alluded to that maybe they're not vacant yet, but they will be. projected to be in July, or they all are vacant?
Look, they're
right
current
now?
vacancies.
They're current vacancies, so.
And we have some additionals that are included that will be coming. Those are the captains, right?
Yeah, so the 3 captains positions, a little bit more detail on that one. So we have potentially 3 retirements coming up, 1 in May and 2 in June. And so what we'll do is we'll leave those vacant and as close as we can until Apple is completed. And then once, right before Apple opens, we'll have to promote them because we're going to have to staff that station. So we'll use that cost savings until we get there. So it's not like we're eliminating them. We're just going to try to use that cost savings to get through what we need to. But eventually, we are going to have to promote those. And it's different from who you talk to with Apple. It could be January, it could be March, it could be June. But somewhere between March and June, we know that we're going to have to fill those positions. So.
Okay, any other questions? Commissioner
Yes,
Clark?
I've got a couple. I'm concerned about the savings of $90,000 for green waste. We're going to save $90,000. I'm wondering what the cost of fires would be if we don't get rid of that waste and it causes a potential fire. I mean, one fire could certainly eat up $90,000 worth of costs if a structure, one structure catches on fire, partial structure fire. So, there's some times when it makes sense to do some cost savings, but other times it's maybe not the best way to go. And that's just a comment. Next, the other question I might have is on Station 40 and 42, when we're going to go from 4-person trucks to 3 persons, how will that affect our agreement with the city of Reno on the mutual aid?
So it would be for our automatic aid responses that I talked about in my last presentation. We're working through those issues on the disparities between 3-person engine companies and 4-person engine companies. We did meet with the labor groups to have those discussions on what are some of the issues. Obviously, we want to always strive to try to get to 4. They understand that because of the budget areas that we're in, we're going to try to work back towards that. And 2 of the things that are the top 2 priorities, once we get through that first tax payment that comes in, the 4-person engine companies and the green waste program. Those are number 1 and 2 priorities to get back up. We are working with our fuels division. Chief I isn't here today, but try to see what other alternatives we can do for some type of green waste program for the community. So, but to answer your question, those are our 2 priorities. And we are working through that with our partners. Sparks runs 3-person engine companies as well. So we're all working collaboratively to see, how we can get through this little part and still strive to keep getting our staffing back to where it needs to be.
Because as I look down the dais, each and every one of the commissioners either has rural properties in their district, or in the case of the chair, a huge forest. So, all of us need this green fuel reduction program available, and that should be a top priority to get that back operational.
Yep, it is.
Thank you.
That actually is the end for the general fund. I'll move on. I know we've taken questions throughout, but if anybody has any specific, or wants to ask questions right now about the general fund some more, we can go, and we'll also have time at the end.
I would say continue on.
Okay, thank you. So one of the, what we are presenting in with this budget is actually a reclassification of the current capital projects fund and a new capital projects or capital fund, which is called extraordinary repairs and maintenances. Both of these will be redefined under the current NRS standards. The current capital projects fund is so old, I think 1970s, that this NRS wasn't even there. So we are writing it to redefine it. It will make it a restricted fund, which it is not currently under accounting standards. And what we want to do is dedicate a revenue source, so a percentage of property taxes. Currently, we have 4%. We'd like to grow that to 7%. And what that would do is give us, we have been budgeting for our capital projects just by transfers of what can we do, but it'll be able to build this fund and be able to address our capital needs and look at it from a future standpoint of 5 to 10 years instead of annually year to year and not really knowing what we're going to do in fiscal year 27 and 28 so that we can build that future year. And that's part of our strategic plan is a multi-year capital plan. So part of that is building these funds so that we have a dedicated revenue source and can do that. So we did start with 7, so that was one of the things we cut down is we took it to 4%, which just covers what we currently have, but we would like to bring that up over the next years to get to eventually 7. The extraordinary repairs and maintenance, as our assets grow old and different repairs or items changes are needed, this is another fund under NRS that would also provide a restricted fund balance, so it cannot be reverted back to the general fund. It comes into here. It allows us to address things like heating, cooling, roofing, paving, in that type of big facilities. They do have a much stricter definition. In the current capital projects, we could pretty much put anything that would meet a general term, but what we're presenting with this current capital projects fund is has to be construction in progress. It would have to meet that definition, which really is all of our apparatus. It's even our command vehicles and our facilities. It wouldn't be things like SCBAs if we had a big $100,000 purchase. It wouldn't be a purchase of a trailer. Those would have to be moved into the general fund and taken with general resources. Okay. And the extraordinary repairs and maintenance, again, those bigger repairs. So if we do have to retank apparatus, we can have those monies set aside so it's not such an impact to try to find the money in the general fund to transfer. We're already scheduling for it and now doing a more future-looking fiscal plan to address those items. So our current capital projects fund, it'll roll over into the beginning. We have about $2.3 million. Some of that is set aside and savings for some apparatus that we had to put on order 3 years ago. The transfer in, which is equal to the 4% of property taxes, about 1.2. So if property taxes go higher or lower, that number would change with that. And other revenues of $12 million, and this is because of the Station 35, so we're going to have that offset from Apple come in, which is also where you see the big expenditures. You've got the $16 million, which will be finishing up some of Station 37, and I have more details on the next slide, and then Apple wrapping up in fiscal 26. Okay, with a projected fund balance of $36,000. So we're using really all of that. The extraordinary repairs and maintenance is, we started at 0.75%, and we would like to get to about 2% with that one. But that will just be a $224,000 kind of starting that. We have other revenues. $250 is about interest income. Expenditures at $196, and we'll go through those on the next slide, with a ending fund balance of $28,000. With that $196, it does include a, actually, let's go over there. Here we go. So the unexpected repairs and maintenance, $175,000 just to be used, and I did start at the bottom of this slide for flow, but that would be used if there is anything. But we would hope that would actually roll forward, that nothing does happen, that actually will come back in 27 to start building that fund. We are going to do some security upgrades to Barron Way, because right now those doors you can't really see in, and anybody can walk right into the building and pretty much get anywhere into that office. But the capital projects fund, so some of the payments that are coming out of there are the P25 radio system. So that we have about, annually, we usually pay about $70,000 under the original agreement, and that would go to fiscal year 2036 for the amounts. But about 2 years ago it started, where they realized what they had to, it was more than they had originally anticipated. So they negotiated with the different entities, and we will have a one-time payment of about $90,000 to make up some of that difference for the actual cost of the system. Now, I know that there's probably discussions of whether that will be enough, but in the recent agreement, that $90,000 is due for fiscal year 26, and that's one time, but about $70,000 will be annually. Furniture and fixtures for Station 37, since that should be done before June 30th, we'll be adding some equipment into the apparatus bay, about $80,000. Station 35 completion, about $12 million into fiscal 26. We have a Type 3 engine that we will be receiving. We already have the grant funds for that, so that'll be offset. That is through the Pennington grant. And then 3 Type 1 engines that we ordered back in fiscal year 24 with the intention that we would not receive them until fiscal year 26 and that we would fund them annually. So that will be coming due, and it looks like towards the end of fiscal year 26, it could push into 27, but that does set the money aside for all 3 of those to be paid. Okay. And that was all for capital that I was going to present. Did anybody want to stop and ask any questions on capital?
I'm not seeing anyone.
Okay. The second annual comp benefits fund, which is our last fund that has been funded through general fund transfers only. It doesn't have any revenue sources. And its original intent was to build up to pay those terms when people leave, those significant compensated absences balance. We have to pay out vacation, we have to pay out comp, sick time, and holiday comp. So sick time is unlimited, but they have to meet a certain threshold to have it paid out, and it starts at 75 to 100%. Holiday comp, which was unlimited, is now we're going to start paying out some of that to try to limit that growth. But we have an unfunded liability that was as of fiscal year 24, so this is the audited balance of about $9 million. That we have to pay, and we used to have about $800,000, and we would pay maybe $30,000 to $40,000, but we have an older demographic, so we are having a lot of retirements. I don't want to say older because they're still younger than me, but they have met their ability. We're years on in our entity, and now we're seeing that ability to retire, and payouts between $100,000 and $200,000 at sometimes. Okay. So we look at this and we actually go through and ask people if they're planning to retire, and that is some of the budget planning on here. And we do a little extra because you don't have to tell us that you're planning on retiring, but we want to be able to meet those needs. So we are projecting a compensated absence payouts about $800,000 next year. Okay. And this one might change a little bit to the from the tentative or what we presented here for the final, because we did find one person was going to postpone and retire in fiscal 26 instead of 25, so it might bring our beginning fund balance up a little bit, but our payouts also up, and our ending fund balance about the same, though. Mm-hmm. Okay. Our emergency fund, this is restricted under NRS. We can have up to $1.5 million. We are still working through all the receipts and everything for the Davis Fire and the Davis, Gold Ranch, and Callahan? Was that her? Callahan. So we're getting all those funds, and that anticipated we are anticipating every cost to be recaptured for those, and there may be a little additional that sometimes doesn't hit just because of the way the benefits are charged. Okay. But right now, we are projecting to start then with $625,000 because that fund does see some events that may not rise to the ability of being reimbursable. So if we have an event that was less than 24 hours, we do not get any money back for that one. Okay. We do budget for expenditures at 1.5, which is the fund balance, or the revenues, the deposits we can have it, and we do budget that will be completely reimbursed. So this fund is only used for events within the district. We use the general fund for outside assignments because those are, for lack of a better term, optional. If we don't have the money, we don't have to go and support California, but we want to, obviously, because we want those people to come and support us too. But these are money set aside for in case of emergency within the district, and to be able to fund those until we can get reimbursement. Our stabilization fund, this one is, we've set aside originally, honestly, it was before me, so it's only been getting interest incomes. We have not funded it, but it sits there and allows about $650,000 to be used. But it has a definition of if the total actual revenue of the local government falls short of the total anticipated revenue. So in general, our revenues have been above our budget, even slightly. So we have not used it. It's an emergency fund, basically emergency. If we need to get it, we can. And that only has about $600,000. We budget to be using about $550 and kind of basically the whole amount just in case. Our debt service fund. We can have a balance of up to 1 year of payments in here, but we're starting at $446,000. That is part of it, and we did set aside a fund balance of $600,000, but we used part of it to make that first payment on the Nevada State Investment Bank that will go out this year before. We didn't have, so it wasn't originally included in the fiscal year 25 budget, but we had the cash to be able to pay it, and that's the difference is our first payment on that debt. So we have 4 bonded debts. The medium term, which is our first equipment bond, that is a 10-year bond that will be paid in full in 2030. Our annual payments are $478,000, and they're through 2 semi-annual payments. That's the total annual amount. General obligation bonds, $2 million. And this was originally used for Station 37 of the house part, and to convert that and buy that property. So that is $157,000 annually. Those 2 have very small, actually the first 3 have very small interest rates. That's a 15-year bond. The $7 million was when we bought the Barron Way, and we did use it for some of the other facilities that we still had running. And that's 25-year bond, and that will also that will pay off in 2046. And I think all of those were under 2% for interest. And we have the Nevada State Investment Bank, which is for the apparatus bay at Station 37, with now $307,000 in an annual, and that is a 25-year payment. So our total annual payments are $1.3 million, which is our transfer in, equals exactly the payments. So our projected ending fund balance stays where it begins. Our emergency medical service fund is our one business type proprietary fund. Just a little bit of information. It's our only business type fund. It'll include the salaries and benefits and accrued liabilities for permanent employees. So their accrued liabilities actually have to be booked and are a liability right on their fund. Plus 18 rotating ambulance staff. So we have 3 ambulances, right? And those they bid for positions on them as part of that, but it's not necessarily always the same person each day. So they're not permanent staff. They run through the operations, and when they're assigned to the ambulance, there's a code that's entered, so it charges to this fund. It is a full accrual fund, so it records additional costs as expenditures or expenses that you don't see in your general fund, and that includes your compensated absences. What they earn, we actually accrue that and charge it as a benefit cost. Their cost for OPEB based on the actuary valuation, PERS, which we get a valuation from PERS that makes you put that liability on their books, even though it's a pay-as-you-go and you will never do anything but pay-as-you-go. And then depreciation. So depreciation on the vehicles, but that is a good expenditure because it's non-cash and we can use that cash later to purchase equipment. Okay. Their beginning net position currently, and it has a slightly different name because of the type of fund, is $2.6 million. Operating revenues, which include your GEMT, running about $3.7 million. There is a reduction in GEMT that is looking, and I know Zeb is really fighting with them because it's going to drop about $1.3 million. So that's a significant decrease from fiscal year, what we will receive in 25 that is based on fiscal year 23. Correct. Okay. So it's kind of 2 years in the rears. Their operating expenses of 6.1, salaries are 3.2 million, benefits 2 million, services and supplies 745,000, and depreciation about 250,000. That does come up with an operating net loss of about 2.5 million. The OPEB estimates are about 10,000. Pension, about 125,000. These are non-cash ones, and compensated absences change about 75,000. Now, the compensated absences will eventually become a cash item, whether they leave or move out. So that is also non-operating income of interest income, 9,000. So your change in net position is a decrease of about 2.4 with an ending net position of 223,000, but there is cash of about 1.7, and I should have probably done a cash presentation, but to show that about 1.7. So it is a fund that is, with the GMT decline, it's something that we're watching closely, but one thing to take into mind on this fund is it also has overhead costs that used to be in the general fund, and that EMS, those positions are still needed regardless of whether we run an ambulance program. So at least probably another $1 million is overhead that would just move to general fund to provide even the medical supplies for the engines, the ambulances that we would still have on standby if we stopped the program. But right now, we will continue to watch this program. No worries about the next fiscal year, 26. Okay. Our last fund is the Workers' Compensation Fund. This is set up as what they call an internal service fund, and it also is a full accrual. So it presents a little bit differently. The only expenditures in here are expenditures for it is recorded as a change in estimates. So what this fund does is it pays, but City of Reno is the only payments that come out of this, and it is for heart and lung workers' compensation claims. So at the end of each year, we use the City of Reno's actuarial report to estimate what that will be, and it's recorded as a liability. As we make payments, they're paid towards the liability, and then there's, at the end of the year, we reassess that liability, and sometimes it goes down and sometimes it goes up. So depending on whether new claims issue or a current claim is reassessed. So that covers Truckee Meadows retirees who retired with the City of Reno under the pre-2012 agreement. Currently, there's about 37 retirees remaining. Just change in estimated claims is the only thing. The cash balance of this account is $2.4 million, and right now we're expected to cover all future costs. We pay about $30,000 a year currently. There's always the risk of a significant costly claim. And we only pay a percentage of these employees based on the time that they were with the City of Reno and Truckee Meadows. Okay. And one of the things, if all 37 employees are gone, which then we can close and any money left can roll back into the general fund. But it currently is self-funds, and I wouldn't necessarily roll any now into it. There's some accounting rules that we'd have to get past, but then we may have to fund it later. Okay. And that is all of our funds.
Okay. Thank you.
And right now, we are looking for any recommendations, any changes that you'd like to see before we bring it back in 2 weeks.
Okay. Go down the line. Vice Chair Herman. Commissioner Garcia. Commissioner Andriola. Okay. Commissioner Clark.
No.
I think the board is in alignment of the priorities of getting greenways back online and our 4-person crews, and then filling those fire positions as a priority that are frozen, understanding that the captains are going to have to be filled as well. So I think that we need to just maybe stay in touch on this budget, as we'll be adopting it on the 20th, correct?
Correct.
And then maybe we do some touch bases on this quarterly so we know
Yes.
kind of where we're at, because we are in such tight cash flow times. And we'll need to kind of see and monitor where C-Tax comes in, and hopefully the state kind of gets their act together on getting us reimbursed on all of that as well. So I think that we're in alignment with the staff recommendations, unless there's any other board questions or concerns. I'm not seeing any. Okay. So do you have what you need today?
Yes.
Okay. And DA Large, do we need to do anything on this?
We need to call for, this is labeled for possible action, so there needs to be public comment.
Okay,
If there is
thank
any.
you. Any public comment, Madam Clerk?
There is none.
But we don't need to take a motion.
You don't need to take a motion on this.
Thank you. Thank you for reminding me about public comment.
And just for the record, are we, I assume on 5D, we are retabling that for final budget?
That's a good question. Do I see nods to table it? I see one nod. I see 2 nods. I'm nodding. Okay, so we'll table it for July with the budget. Okay, or we can rewrite it and bring it back to our budget hearing and rewrite it to start in July, if that's what you want.
Okay.
Is another way we could do it. Anyway, and we'll do that on the 20th. Okay, with that, do we have a closed session today?
We do not.
Okay, thank you. We'll now move into item 16, Chief.
Item 16, Commissioners, Fire Chiefs announcements, requests for information, topics for future agendas, and statements relating to items not on the agenda. No discussion among commissioners will take place on this item.
Thank you. Do you have anything else for us, Chief?
I do not.
Okay, Vice Chair Herman, Commissioner Garcia, Commissioner Andriola, Commissioner Clark.
Thank you, Madam Chair. One quick question. I continue to bring up this bulldozer. I'd like to find out what it exactly costs per hour to rent that out or loan it out, what it costs for the whole operation, the truck, the trailer, the equipment, and also the salaries that are involved with the operators. I'd like to see that number. Thank you. And the number of hours that it was sent out last year. Thank you.
Thank you, Commissioner Clark. Okay, with that, we'll move into item 17, Chief.
Item number 17 is our final public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board of Fire Commissioners' agenda. Comments are to be made to the Board of Fire Commissioners as a whole.
Thank you very much, Madam Clerk.
No one has signed in.
Okay, thank you for hanging in there, everyone. It was a long but very productive meeting. We will be adjourned at 1:23.